anything about it.
Yes, like we don't practice much EMDR, so that's why I think very less people know about or less people use EMDR as a therapy. So let's in 1 hour, hope everyone will get some idea about EMR, what is EMDR, and how, if anyone have interested in further, you can, if you want to choose as a therapeutic process, then you can use it as well. So let's see about the, okay, someone message, don't know anything, ma'am. Okay, new today concept. Okay, then fine. So everyone will be more like focused in during the presentation, I hope. Okay, so even if you are not able to speak due to like your circumstances, work, so you can text, no problem. Okay, so I think who all are new in the group, they may don't know, and but who all are already in the group in nurture mental health, you are aware that we try to organize free workshop weekly. So this is one part of it. Okay, Rakshita, know little bit. Okay. Okay, fine, great. So this is one of them, that workshop. Okay, so today we'll learn about the EMDR, and I'm the founder of Nurture Mental Health, and Krisha Gala, she will be presenting. She is a psychology intern in Nurture Mental Health. Okay, and like I'd like to hand over her, and she will explain all about the EMDR. So let's hear Krisha Gala. Okay, Krisha, you can present. I'll make you host.
Yes, ma'am. Thank you so much, ma'am. So
Welcome.
good evening, everyone. I am Krisha Gala. I am currently I'm doing masters in counseling psychology, and as ma'am said, I am an intern at Nurture Mental Health. So today I will be explaining about EMDR therapy. I will be using English and Hindi languages. If you at all find any difficulty in between, you can directly unmute it and ask the doubts. If at all you have any doubts, which or at all in any case you cannot unmute it, you can post it in the chat box, and I will be going through the chat box in between. I guess one of them said that they have slight idea about what EMDR therapy is. Can you just say about what you have an idea? Ma'am, you are on mute.
Sorry, I think it's Raksha. I saw her message. You said that I know a little bit about it. Is Raksha? Do you
Hi, Raksha.
would like to?
Could you please? Yeah.
Okay, it's
Okay.
Lakshmi.
Yeah. So I'll be starting with the presentation. Do let me know if you can see the screen. Is the screen visible to you all?
Yes, it's visible.
Okay, great. Does anyone
Lakshmi,
wants to
yeah.
answer?
Lakshmi, Manu, kindly mute yourself. Yes, thank
Yes,
you.
please, to avoid disturbance. Yes. Thank you so much. Okay. So yes. Eye movement desensitization and reprocessing EMDR therapy. As you can see, my name is Krisha Gala. Once again, I'll introduce to those who have joined late. I'm Krisha Gala. I'm doing Masters in Counseling Psychology, and I'm an intern at Nurture Mental Health. So yes, this is the YouTube link of our organization, Nurture Mental Health. Please do subscribe. Do click on the bell button. You can take a screenshot. I will also be posting the YouTube link in the chat box as well later on. Yes, this is a Instagram handle at the rate nurture underscore mental underscore health. You can take a screenshot. Also, I'll be posting on the chat box. Do follow us on YouTube and Instagram handle, okay, to get more updates. So now we will begin EMDR. Okay, so you can see 4 letters EMDR. So E stands for eye, M stands for movement, D stands for desensitization, and R stands for reprocessing. Eye movement, basically movement of eyes. I'm sorry. Um, Desensitization. Now, what is desensitization is like basically you are being when you feel bothered about an experience, about an incident, this desensitization helps us to become less bothered about an incident. So it's like, let's say you are scared of a spiders, but you gradually get used to them. Like how? By looking at pictures of the spiders, then slowly and gradually being in the same room, and then eventually even holding a spider. Desensitization helps us to overcome fears or anxieties slowly by exposing to them, so that we are unafraid about it in a safe environment. So this is basically desensitization, कि जहाँ पे हमारे जो fears है वो overcome होते हैं. If I guess
Everyone,
somebody is.
kindly mute yourself. Zinsi, Pallavi. Thank you,
Yes,
guys.
thank you. So this was desensitization. Next, reprocessing are, so it's like you are cleaning up your thoughts and feelings. So like you are taking your old memories, you are reprocessing them, and so that you feel easier and better with that experience. EMDR therapy. So, as we all know what therapy is, it's basically of dealing with the problems and feelings in a safe and supportive environment. And also you can release what is bothering you, like stress, sadness, or worries. Okay, so this was EMDR. Now, this words and their meaning itself says a lot about what EMDR therapy is, but that is not. We have a lot more. There are many phases of EMDR therapy, and we will slowly and gradually go about it. Okay, so EMDR, I'll say in short EMDR only. So this was developed in the late 1980s by American psychologist Francine Shapiro. So his work was to work on traumatic memories and the symptoms of stress which are associated with them. So this treatment, EMDR treatment, it's a specific method. It is a step-by-step procedure to treat with trauma and their own symptoms. So basically, here we connect the clients safely and moderately with their own body image, their personal thoughts, their emotions, their feelings, and also we freeze patient with their natural healing abilities. यहाँ पे हम क्लाइंट्स को सेव करवा, मतलब जो एक्सपीरियंस, जो ट्रॉमेटिक मेमोरीज वो एक्सपीरियंस कर रहे हैं, यहाँ बेसिकली जो कहाँ पे बेसिकली बॉडी इमेज में जो थॉट्स फीलिंग्स जो भी वो एक्सपीरियंस कर रहे हैं, ये EMDR थेरेपी हेल्प करता है टू फ्री विद दैट ट्रॉमेटिक मेमोरी. ओके, yes. Now there is a technique which is used in EMDR therapy that is called as bilateral stimulation. Bilateral stimulation or side to side eye movements to reprocess disturbing memories. Okay, you can see in the picture, like the finger is moving from right to left, from left to right. This is bilateral stimulation. It is a technique which is used in the therapy or a counseling where your both the sides of your body are stimulated simultaneously. Like this side of the body is being stimulated, then again this side of the body is being stimulated. So let's say, imagine you are feeling anxious about a past event, or like let's say a car accident. So in therapy, your counselor might use bilateral stimulation by asking you to follow your fingers, moving back and forth with your eyes, while at the same time you are discussing the incident. So basically ये जब आई मूवमेंट यहाँ से from right to left, from left to right, your eye movement, so basically you will be completely focusing on the finger, your head will be still, your body will be still, and सिर्फ हम आँख चलाएंगे, we will move back and forth, right to left, left to right. So ये जो finger रहेगा वो therapist का रहेगा, and we as a client will just move back and forth. Okay, this is bilateral stimulation, side to side eye movements. This is one of the major technique which is being used in EMDR therapy. Also, there is a tapping. So basically, ye two fingers. You, if suppose a client will use this bilateral stimulation some other way, not basically with eye movements, but with also by tapping. मतलब कि जहाँ पे you will tap your fingers on specific body parts, on hand, on shoulders, on your hips. We will see about it gradually, but this is just a gist of what bilateral stimulation is. Okay. Also, research has stated that this bilateral eye movements you helps us unlock the unprocessed memory. It helps us releases the painful emotions and sensations which you are experiencing, and also allows the brain to let go of the beliefs that hold us back. सो ये बायलेटरल आई मूवमेंट्स ये हमें हेल्प करेगा जो भी अनप्रोसेस्ड मेमोरीज हमारे ब्रेन में है, जो भी ट्रॉमेटिक मेमोरीज हमारे ब्रेन में है, जो पेनफुल इमोशन सेंसेशंस वी आर एक्सपीरियंसिंग. This bilateral eye movement technique will help the brain to let go of the beliefs कि ये जो भी सारे हम लोग इमोशंस सेंसेशंस एक्सपीरियंस कर रहे हैं वो सारी निकल जाएंगी धीरे धीरे करके with the help of the technique called bilateral eye movements. Okay. And one reason, it can be like REM sleep and EMDR therapy, they both act like together. So because we can say that the neural activity in the brain is similar what happens in bilateral eye movements and also what happens in um, uh, REM sleep. So let's revise it. REM is one of the four stages of a sleep which occur in repetitive cycle. So four stages of sleep. First stage, light sleep. Second sleep is a deeper sleep, which your body starts to relax more. Third is deep sleep, which it's is anyone unmute? I guess. Could you please mute yourself? Yeah.
Jessica, Lizette, kindly mute yourself. Thank you.
Guys, please mute yourself to avoid disturbance and also to break the link. Please. Yeah. Thank you. So yeah, once again I'll revise. Stage 1 is light sleep where you are easily awakened. Stage 2 is deeper sleep where your body starts to relax more. Stage 3 is deep sleep where it is harder for you to awake yourself, or it's harder for others to wake you. And stage 4 is REM sleep, rapid eye movement. So, where your brain is active and you have vivid dreams. Like, let's say you have a busy day at work and you are feeling exhausted when you finally go to bed. So, as you start to fall asleep, you enter the first stage of sleep, which is light sleep. So, your body relaxes and you are still easily awakened. Now, as the night goes on, you progress through deeper stages of sleep until you reach REM sleep. So, REM sleep is the fourth stage of sleep. Okay, so your brain becomes highly active and you are highly awake, you can say, but your body is at a, like, let's say, temporary paralysis. So, like, you are experience vivid dreams, as I mentioned before, like you're flying or you're meeting someone from your past. This happens during REM stage. The same thing happens during EMDR therapy when you're doing bilateral eye movements. Now, how and what, how it goes about it, we'll see in the further slides. But just to let you know that EMDR therapy is related to REM sleep. Okay, so like scientists have believed that during REM sleep, our brain processes events of the day, including our emotions, our beliefs, and also our physical sensations. So, if brain does not process all these memories properly, memories may become stuck, it may become lost, and these causes us problems. Bilateral eye movements, as I mentioned, these unlocks the unprocessed memory, releases painful emotions, sensations, and it also allows brain to let go of the beliefs. This is basically EMDR therapy, जहाँ पे जो भी ब्रेन प्रोसेस नहीं कर पाते हैं, जो मेमोरीज प्रोसेस नहीं कर पाते, ये EMDR therapy helps us to reprocess them. So after EMDR therapy, your memories may seem faded. मतलब जो कोई information जो अनइम्पॉर्टेंट है हमारी लाइफ में, हमारे प्रेजेंट में या फिर हमारे फ्यूचर के लिए, वो डिस्कार्ड की जाती है with the help of EMDR therapy. But yeah, EMDR therapy does not delete memories, because अगर memory delete हो जाएंगी तो हम लोग सीखेंगे भी क्या, because हर एक मेमोरी से हमें कुछ सीखने मिलता है. So if your painful memories, if it is processed properly, then it helps us to become stronger and wiser, and it also prevents us from having to go through the same experiences again. So simply stating, like EMDR helps us the way painful experiences are stored, so that when you think about that painful experience again, they no longer trigger negative emotions or sensations. ये EMDR थेरेपी हेल्प करेगा कि अगर सेम अगर एक्सपीरियंस हमारे फ्यूचर में हुआ है और अ सिमिलर एक्सपीरियंस हैपेंस इन द फ्यूचर, वो जो ट्रॉमेटिक एक्सपीरियंस, जो पेन हमें होता है, वो हमें फिर से नहीं होगा. सो बेसिकली योर पर्सपेक्टिव, योर वे ऑफ लुकिंग टू दैट ट्रॉमेटिक इवेंट कंप्लीटली चेंजेस. Okay. So this was a gist about what EMDR therapy is. Uh, do anyone have doubts, or can we go ahead?
Question we can take in last. Now we can move forward.
Okay. Yeah. Okay. Done. So we will take questions in the last. Next, what can
Ma'am,
EM? Sorry, ma'am.
just
No,
a
no, I didn't say anything.
request, if you can speak a little slow, that would be more easier to understand.
Yes,
Oh,
ma'am, I agree as well.
okay.
Okay.
Okay. Uh, okay, so I'll just give a brief. EMDR therapy में bilateral stimulation technique यूज होता है. Bilateral stimulation technique basically आई मूवमेंट्स होते हैं, मूविंग बैक एंड फोर्थ, जहाँ पे हमारा बॉडी स्टिल रहता है, हमारा हेड स्टिल रहता है, ओनली आर आई मूवमेंट्स goes from back to forth. Okay, so ये टेक्निक इट लिंक्स टू REM स्लीप, बिकॉज REM स्लीप में भी हमारा ब्रेन एक्टिव होता है, यहाँ पे भी हमारा ब्रेन एक्टिव होगा. यू विल बी कॉन्शियस अवेयर EMDR थेरेपी के टाइम पे. सो EMDR थेरेपी क्या करेगा कि जो भी ट्रॉमेटिक एक्सपीरियंस आप एक्सपीरियंस कर रहे हो अभी फिलहाल, ये आगे चल के वो एक्सपीरियंस आप ना करो. मतलब जो पेन अभी आप एक्सपीरियंस करते हो, अगर वो सिमिलर इवेंट आपके सामने आ जाता है, तो आगे चल के आप वो एक्सपीरियंस नहीं करोगे. सो ये EMDR थेरेपी हेल्प करता है आपको इस चीज में, बेसिकली विद ट्रॉमेटिक एक्सपीरियंस.
मैम, ये
ओके.
जो हमने फिंगर का मूवमेंट बताया कि बैक एंड फोर्थ मूव करना है, इसका कोई
या
क्राइटेरिया कि फॉर हाउ मेनी मिनट्स और रेपिटेशंस
आई विल बी एक्सप्लेनिंग इट फर्दर. This was just a just to let you know what is bilateral stimulation, so that आगे के slides में जब मैं बताऊंगी कौन से phase में कब ये use होता है, so you will get an idea कि हाँ ये bilateral stimulation है basically.
ओके, थैंक यू.
Yes, welcome. Okay. Next we will be move like what can EMDR be used for. मतलब पहले ऐसा बोलते थे कि EMDR ट्रीट थेरेपी सिर्फ यूज होता है ट्रॉमेटिक मेमोरीज के लिए, बट नाउ इट इज यूज फॉर वेराइटी ऑफ डिसऑर्डर्स. एज यू कैन सी ऑन द स्लाइड, इट कैन बी यूज फॉर PTSD, OCD, GAD, support during mourning, victims of sexual abuse, psychological support in natural or human disasters, male sexual problems, substance anxiety, क्रॉनिक पेन कंट्रोल, डिप्रेशन एंड फोबिया. ये सारी प्रॉब्लम्स के लिए EMDR थेरेपी यूज हो सकता है. इट्स नॉट, मतलब previously it was being told that it can be used only for PTSD, only for traumatic experience, but no, due to thorough research we got to know like it can be used for these several problems. Okay. Now it's like most of them like think कि trauma सिर्फ major events से होता है, like war, sexual abuse or a serious injury. But no, trauma can also be caused due to smaller incidents, smaller everyday incidents जो process नहीं होता है brain में. Now, Francine Shapiro, who was the developer of EMDR therapy, he states that smaller events can cause much more severe symptoms of distress than major traumas. Now, it can be as minor as being called stupid in front of the class. It could be enough to trigger trauma symptoms. So, any disturbing memory that causes an emotional or psychological reaction, it is one of the good target for EMDR therapy. Like daily stress, we can say emotionally charged experiences, including family arguments, work problems, stress, poor relationship choices, ओवर रिएक्टिंग टू नॉर्मल सिचुएशंस. सो ये छोटी छोटी चीज़ें जो हमें ट्रॉमा दे सकती है, नॉट नेसेसरी मेजर इवेंट्स ही दे, ये छोटी छोटी चीज़ें जो हमारा ब्रेन प्रोसेस नहीं कर पाता है, this also can be treated. Okay, so for all these, for severe problems and also for everyday smaller incidents, EMDR therapy can be used. Next, why some memories become stuck. Okay, so now all of us experience distressing and disturbing events in our lives from time to time. So in normal circumstances, the brain processes these events during sleep by making new connections. um, like you discard the bits of information that are unimportant and transform negative thoughts and sensations into lessons learned. सो हम लोगों ने ये पहले ही देखे थे कि अगर नॉर्मल सर्कमस्टेंस में क्या होता है कि ब्रेन प्रोसेस करता है हमारे इवेंट्स को ड्यूरिंग स्लीप, वी मेक न्यू कनेक्शंस, कुछ चीज़ें हम भूल जाते हैं, डिस्कार्ड की जाती है कुछ बिट्स ऑफ इंफॉर्मेशन विच आर स्पेशली अनइम्पॉर्टेंट, एंड देन वी ट्रांसफॉर्म द नेगेटिव थॉट्स इनटू द लेसन्स लर्न, मतलब हमें कुछ सीखने मिलता है. तो जैसे मैंने पहले कहा था कि अगर मेमोरीज कंप्लीटली डिस्कार्ड नहीं की जाती है, बिकॉज अगर मेमोरीज डिस्कार्ड की जाएंगी वी वोंट बी एबल टू लर्न समथिंग. दैट्स द रीजन. सो ये होता है नॉर्मल सर्कमस्टेंस में, इट हेल्प्स अस टू अडॉप्ट एंड टू सर्वाइव आवरसेल्फ. Now, sometimes an event may occur that it is so disturbing that it overloads the brain and it also prevents us from completing this all important memory processing task. मतलब कभी कभी एक डिस्टर्बिंग थॉट, लाइक आई मेंशन बिफोर, यूज कॉलिंग स्टूपिड इन फ्रंट ऑफ द क्लास, इट कैन बी सो डिस्टर्बिंग टू अ ब्रेन, लाइक इट प्रिवेंट्स अस फ्रॉम कंप्लीटिंग जो ऑल मेमोरी प्रोसेसिंग टास्क होता है ड्यूरिंग स्लीप, वो प्रिवेंट करता है ऐसे डिस्टर्बिंग थॉट्स, मतलब वो स्लो डाउन हो जाते हैं. So instead, the memory gets stored along with physical sensations and the negative emotions as well. And often repeatedly, like the triggered in our events which are triggering in our everyday lives. मतलब जो भी ट्रिगरिंग इवेंट्स होते हैं जो हमें ब्रेन में ही रह जाते हैं, रिप्रोसेस नहीं होते हैं, वो फिजिकल सेंसेशन ऑफ द बॉडी, योर इमोशंस, फीलिंग्स के साथ रजिस्टर हो जाता है एंड वो रिप्रोसेस नहीं हो पाता. Now, these unprocessed memories can impact on seemingly unrelated areas of our lives, which are triggered by things or people that reminds us of the event. मतलब लेट्स से कि बचपन में अगर कोई टीचर ने, जैसे मैंने कहा था स्टूपिड वाला एग्जांपल ले लेते हैं, बचपन में टीचर ने आपको सबकी क्लास के सामने बोल दिया था स्टूपिड, तो वो एक हिट की आपको अभी तक भी वो दिमाग में रह रहा है कि सबके सामने मुझे एम्बेरसमेंट हुआ स्टिल. एंड अगर ऐसा कोई सिमिलर एक्सपीरियंस होता है, यू एक्सपीरियंस द सेम फीलिंग ऑफ एम्बेरसमेंट और फियर अगेन. नाउ आफ्टर फ्यू ईयर्स, लाइक लेट्स से अ फ्यू ईयर्स लेटर, अगर आपके बाजू वाले नेबरहुड फ्लैट में अगर कोई नया फैमिली आके रह रहा है वहाँ पे, एंड जो वुमन है दैट रिसेंबल्स सिमिलर टू द टीचर who has told you that you are being stupid, and then there is a flashback of your memories of fear and embarrassment. ओके, सो मतलब ये जो भी अनप्रोसेस मेमोरीज हो जाती है, तो ऐसा जरूरी नहीं कि उसी टाइम पे आपको ट्रिगर करे, आगे चल के भी वो आपको ट्रिगर कर सकती है, सिमिलर अगर एक्सपीरियंस आपको हुआ तो. Now we got to know that how memories are stuck and how it impacts our daily lives, right? Now, why some memories are processed and others are not? Why some people are so affected by some events and other people are not being affected by such events? Why does this happen? So it can depend basically on the perception of the disturbance. सो मतलब आपका देखने का इंडिविजुअल परसेप्शन ऑफ द डिस्टर्बेंस, कि आपका देखने का नजरिया वो इवेंट के रिलेटेड, ऑल्सो द लेंथ ऑफ द टाइम विच इज एक्सपोज, कि कितने टाइम के लिए आपने वो ट्रॉमेटिक एक्सपीरियंस ट्रॉमेटिक एक्सपोजर लिया हो. ऑल्सो जेनेटिक्स प्ले अ पार्ट, कि अगर चाइल्डहुड में आपने बुलिंग एक्सपीरियंस किया हो या फिर अब्यूज, ह्यूमिलेशन, डिसअपॉइंटमेंट, और इवन सीवियर प्रॉब्लम्स लाइक पीटीएसडी और अदर मेंटल हेल्थ इश्यूज, this also hinders our memory processing task. So मतलब कि the way people see and understand things and how they remember are completely different. So what seems small to one person might be very upsetting to someone else because of their past experience and beliefs. मतलब एक जन के लिए वो बहुत मामूली चीज़ होगी, एक जन के लिए वो बहुत मेजर चीज़ होगी. So like let's say if some person A is scared of heights and person B is not scared of heights. So person A might even find difficulty in climbing a ladder. Well, person B को ऐसा कुछ problem ही नहीं होगा ladder climb करने के लिए. So your individual perception plays a role. ओके. नेक्स्ट अगर दूसरा एग्जाम्पल में देखें कि फॉर एग्जाम्पल two boys are or like I said two brothers basically they are uh, like they are seeing a couple fighting. So the first brother or the first boy, the one who grew in a happy and loving home, might think that it's a small fight, and even he will even forget about it. But the second brother or the second boy, he would think the one who has grown in a tough environment because his parents used to argue a lot, so he would feel really upset and find it hard to deal with their fighting. बिकॉज एक जन ने एक्सपीरियंस ही नहीं किया है ऐसा कभी फाइटिंग पहले, कभी वो एक्सपोजर ही नहीं मिला है, सो उसको लगेगा कि ठीक है मामूली फाइट है एंड भूल भी जाएगा. जबकि दूसरा लड़का, दूसरा ब्रदर, वो क्या सोचेगा कि उसके पास्ट में ऐसे एक्सपीरियंस हुए हैं जहाँ पे पेरेंट्स ही उसके बहुत फाइट करते थे, बहुत आर्ग्यू करते थे, तो उसके लिए बहुत हैवी हो जाता था, बहुत ट्रॉमेटिक भी हो सकता था वो. सो सेम यहाँ पे एक्सपोजर ड्यूरेशन, कितने टाइम के लिए आप ट्रॉमेटिक एक्सपीरियंस कर रहे हो, ट्रॉमा एक्सपीरियंस कर रहे हो, वो मेमोरी का एक्सपीरियंस कर रहे हो, दैट ऑल्सो मैटर्स एंड दैट हिंडर्स आर मेमोरी प्रोसेसिंग टास्क. इसीलिए ही कुछ मेमोरीज स्टक हो जाती है, कुछ मेमोरीज स्टक नहीं होती. ओके. या अब हमें पता चला EMDR थेरेपी क्या है, हमें ये भी पता चला कि वो किस किस के लिए यूज़ होता है एंड कौन सी मेमोरीज के लिए यूज़ होता है एंड क्यों वही मेमोरीज के लिए यूज़ होता है, ये सब कुछ हम लोगों ने देख लिया. अभी हम देखेंगे कि EMDR कैसे वर्क करता है. नाउ विथ EMDR people can safely process traumatic information until it is no longer psychologically harmful to their lives. I'll explain it further. So basically idea क्या है कि sometimes in our lives things happen like that we have enough psychological resources to deal with. मतलब कि वो ट्रॉमेटिक एक्सपीरियंस अगर फॉर एग्जांपल कार एक्सीडेंट ही देखा, अगर उनके पास कोई साइकोलॉजिकल रिसोर्सेज अवेलेबल हो सकती है और लेट्स से अगर उनके पास कोई फ्रेंड साथ में होगा जो मे बी उनको वहाँ से लेके जा रहा हो और मे बी बोलेंगे कि ओके देखा किसी ने हेल्प कर दिया, ओके फाइन डन, किसी के साथ आप चले गए, सो मे बी अ सपोर्ट ग्रुप हु इज देयर विथ यू एट दैट टाइम. सो बेसिकली मेरा बोलना ये है कि अगर हमारे पास लिमिटेड साइकोलॉजिकल रिसोर्सेज होते हैं, दिस कैन लीड टू कि वो एक्सपीरियंस हमें ट्रॉमा में कन्वर्ट हो जाता है एंड वो रिप्रोसेस नहीं हो पाता. सो दिस लैक ऑफ मेंटल रिसोर्सेज which I mentioned just now, it can be due to several reasons. Like because we were very young and we did
Sorry
not,
to
yeah,
sorry to interrupt, ma'am. I just missed. Can you please repeat the?
yeah. Uh, uh, Up to when did you hear? Could you just tell me?
You started saying how does it work? That I missed from the initial traumatic वो जो बताया आपने.
हाँ, तो बेसिकली मैं ये बोल रही हूँ कि ये EMDR थेरेपी में क्या होता है कि अगर पीपल आर एक्सपीरियंसिंग कोई भी ट्रॉमेटिक इंसिडेंट, जैसे मैंने कहा कि कार एक्सीडेंट एक पर्सन के लिए वो नॉर्मल लगेगा, क्यों? क्योंकि वो उसके साथ फॉर एग्जांपल कोई साथ में होगा, अ सपोर्ट ग्रुप इज प्रेजेंट एट द टाइम. सो बेसिकली वो एक्सीडेंट हुआ, किसी ने हेल्प किया, एम्बुलेंस बुलाया, लेके गए तो ठीक है, फाइन डन, सपोर्ट ग्रुप होगा, तुम लोग वहाँ से निकल जाओगे, सो वुड फील लेस ओवरवेलमिंग बेसिकली. और अगर देर आर चांसेस कि अगर तुम्हारे पास वो, सो बेसिकली दीज आर मेंटल रिसोर्सेज. अगर ऐसा मेंटल रिसोर्स तुम्हारे पास अवेलेबल नहीं हो पाता है जब यू आर एक्सपीरियंसिंग दैट ट्रॉमेटिक इवेंट, देन इट लीड्स टू अ ट्रॉमा एंड वो रिप्रोसेस नहीं हो पाता. तो दिस लैक ऑफ मेंटल रिसोर्सेज विच आई मेंशन्ड, इट इज ड्यू टू सेवरल रीजंस. Like first, because we were very young, so we did not build the resources to deal with the adversity maybe. Also, second reason might be that we are unable to process the events which are happening, like due to influence of alcohol or any drugs or in any delicate situations, let's say during sexual intercourse or unfamiliar environment, support network, मतलब कुछ भी अगर you're not unable to process the event that had happened, basically. And third reason is the event was so extreme that happened in a very unexpected way, violent assault, kidnapping. तो ये चीज़ों के टाइम पे अगर हमारा मेंटल रिसोर्सेज कम होता है, वी लैक मेंटल रिसोर्सेज, मतलब अगर फॉर एग्जांपल पर्सन ए इज बीइंग किडनैप्ड, सब कुछ हो जाता है, नॉर्मल थिंग्स आर बैक टू नॉर्मल, ही इज बैक टू हिज फैमिली, तो क्या होता है कि ही हैज अ सपोर्ट ग्रुप, ही हैज मेंटल रिसोर्सेज कि यस देयर इज समवन विद मी नाउ, धीरे धीरे करके वो एक्सपीरियंस चला जाएगा, सो बेसिकली वो मेंटल रिसोर्सेज अवेलेबल है. व्हाट इफ नो वन इज देयर ड्यूरिंग हिज और हर हार्ड टाइम, क्या होगा? ये रीप्रोसेस नहीं हो पाएगी. वो जब भी सिमिलर एक्सपीरियंस केस देखेंगे या कुछ भी होगा, वो फिर से ट्रिगर करेगा, फ्लैशबैक्स आएंगे, कुछ भी इमोशन सेंसेशन एक्सपीरियंस करेंगे वो फिर से उसी टाइम पे एक्सपीरियंस करेंगे जब वो सिमिलर इंसिडेंट को देखेंगे. तो so basically, memories which are related to all these events may arise that have not been processed correctly, right? So like it's like they are frozen in our brain in a raw form. मतलब memory आई वो ऐसी ही raw form में रही है, वो reprocess नहीं हुई है because due to lack of mental resources. अगर यही चीज को हम मेटाफोर में देखें, like let's say a traumatic event is a capsule, ठीक है, which is being separated from minds that have been well processed. मतलब कि एक कैप्सूल को बाकी के कैप्सूल से अलग रख दिया गया है. प्रॉब्लम क्या होगा कि these sorry, कैप्सुलेटेड मेमोरीज, वी कैन से इट एज एनकैप्सुलेटेड मेमोरीज, बिकॉज ये वाला ट्रॉमेटिक मेमोरी अलग किया गया है, वो हिंडर कर रहा है हमारे साइकोलॉजिकल फंक्शनिंग में, which we are suffering in the present in the form of like experiencing anxiety, low self esteem, or problems in relationships like difficulty in bonding. So EMDR थेरेपी क्या करेगा कि ये जो कैप्सूल होंगे ये रीप्रोसेस करेगा और बाकी के कैप्सूल बाकी के मेमोरीज के साथ रिलेट करेगा, वो भी कभी सेफ एनवायरनमेंट में, एक थेरेपी में, एक ट्रेन्ड प्रोफेशनल के साथ, जहाँ पे पेशेंट के पास या क्लाइंट के पास चांस होगा वो ट्रॉमेटिक एक्सपीरियंस को फिर से देखने का इन अ मोर हेल्दी वे. यहाँ पे आप पहले अभी अगर ऐसे ही देखोगे तो वो फिर से हमें फिजिकल सेंसेशन, साइकोलॉजिकल फंक्शनिंग पे बेसिकली अफेक्ट होगा. बट इफ इन अ सेफ एनवायरनमेंट,
Komal, Binod, kindly mute yourself.
So much disturbance, it breaks the concentration even.
Yes. Binod, kindly mute yourself. Please, and everyone understand it's disturbing actually.
yeah.
Okay,
Thank you.
Krisha, there is a question in the chat box. Can you explain again the capsule thing?
Yeah, sure. So this we will see from a metaphor point of view, okay, कि ट्रॉमेटिक मेमोरी समझ लो वो एक कैप्सूल है जो बाकी के कैप्सूल से अलग कर दिया गया है. मतलब ये एक ट्रॉमेटिक मेमोरी है, बाकी के मेमोरीज प्रोसेस हो चुकी है हमारी ब्रेन में, बट ये एक वाला मेमोरी प्रोसेस नहीं हुआ है, तो हमें इसे कैप्सूल का दे देते, एनकैप्सुलेटेड बोल सकते हैं इसे. तो ये हमारे साइकोलॉजिकल फंक्शनिंग को हिंडर कर रहा है. Could anyone please mute yourself, please? Others are getting disturbed. Yeah. So what happens कि ये कैप्सूल जो है, ट्रॉमेटिक कैप्सूल हम लोग बोलते हैं, एनकैप्सुलेटेड मटेरियल जो है वो बाकी के कैप्सूल से अलग कर दिया गया. तो अगर हम अभी देखेंगे ये हमारे प्रेजेंट को अफेक्ट कर रहा है. कैसे कि हम एंजाइटी फील कर रहे हैं, हम लो सेल्फ एस्टीम है, और बेसिकली रिलेशनशिप प्रॉब्लम्स है, लाइक यू फील डिफिकल्टी इन बॉन्डिंग विद अदर्स इन दिस फॉर्म. अब EMDR थेरेपी में क्या होगा कि ये कैप्सूल रीप्रोसेस होंगी और बाकी के कैप्सूल से उसे जोड़ा जाएगा कि ट्रॉमेटिक मेमोरी विल बी रीइंटीग्रेटेड टू अदर मेमोरीज, बाकी की मेमोरीज को साथ लाएंगी, कोऑर्डिनेट करेंगी. सो ये कब होगा? सेफ एनवायरनमेंट में, थेरेपी में, ट्रेन्ड प्रोफेशनल के साथ, जहाँ पे क्लाइंट को चांस मिलेगा कि ये ट्रॉमेटिक एक्सपीरियंस वो फिर से एक्सपीरियंस करेगा, बट इन अ मोर हेल्दी वे में वो करेगा। जबकि अगर हम एक्सपीरियंस करेंगे तो वो हमें एंग्जाइटी देगा, लो सेल्फ एस्टीम एक्सपीरियंस होगा। बट अगर वो सेफ एनवायरनमेंट में थेरेपिस्ट के साथ, ट्रेन प्रोफेशनल के साथ, EMDR थेरेपी के साथ हम लोग एक्सपीरियंस करेंगे, तो वो मोर हेल्दीली वे में हो जाएगा। So after reprocessing, remembering will not be as painful as it was. So as it was previously traumatic, में अभी वो ट्रॉमेटिक इतना एक्सपीरियंस नहीं होगा और वो अभी के प्रेजेंट लाइफ में इतना अफेक्ट नहीं करेगा। ओके, सो दिस वाज बेसिकली वो एक कैप्सूल का एग्जांपल लेके हम समझ सकते थे कि कैसे वो ट्रॉमेटिक इवेंट अलग हो जाता है और EMDR थेरेपी से वो कैसे रीइंटीग्रेट हो रहा है बाकी के मेमोरीज के साथ। But yeah, many people may think like I don't even suffer because of the past, or I don't even think I have the trauma. Like हम लोगों ने सुना होगा किसी से कि हाँ, हम लोग ऐसा बोलते हैं कि मैं पास्ट से सफर नहीं कर रहा हूँ, आई डोंट इवन थिंक दैट आई हैव अ ट्रॉमा। ये कब होता है? कि जब पर्सन को लगता है कि हाँ, पास्ट इवेंट वो आज इररेलेवेंट है उसके लिए, तो उसको कोई इनकन्वीनियंस नहीं है, नॉर्मल अगर पॉइंट ऑफ व्यू से देखा जाए तो। बट इफ यू लुक इट फ्रॉम अ थेरेपी पॉइंट ऑफ व्यू, अगर हम टॉपिक ऑफ थेरेपी पे आएंगे, सो व्हाट इट कैन बी फाउंड दैट द मेमोरी विच इज लिंक्ड टू these specific events is emotionally charged, and it still has an effect on the present moment because it was not correctly processed when it happened. जब वो हुआ था तब वो रीप्रोसेस ही नहीं हुआ था वो मेमोरी, तो वो एक इमोशनल बैगेज लेके ही चल रहा है, तो वो आज भी हमें इफेक्ट कर सकता है इन सम और द अदर वे। So an essential task of EMDR therapy is to find the connections between the current suffering and the memories which are not correctly processed, and afterwards to reprocess them. Okay, this was how EMDR works. ये एक छोटा सा जस्ट था। इसके EMDR के 8 फेजेस है। वी विल गो अबाउट लाइक एक एक फेज पे हम जाएंगे, क्या होता है हर एक फेज में, कैसे, कब, कितने टाइम तक यूज किया जाता है, विल ऑल सी अबाउट इट। बट बिफोर दैट आई वुड लाइक टू शो यू अ वीडियो जहाँ पे पहला वीडियो देख लो, यू विल गेट एन आइडिया कि EMDR थेरेपी कैसे वर्क होता है, एंड देन व्हेन वी मूव अबाउट द स्टेजेस तो एक आइडिया आ जाएगा कि यस, ये स्टेज में भी ये फेस का है बेसिकली। या I'll start with the video.
Your therapist will ask you to look back at the trauma and think, what negative thought about yourself do you have from that experience? What would you like to believe about yourself going forward? How bad does it feel to you right now?
Is it audible?
Yes. Audible.
Yes, ma'am.
Okay, yeah. Thank you.
Have from that experience? What would you like to believe about yourself going forward? How bad does it feel to you right now? You'll start processing a memory from there. Your therapist will have you move your eyes back and forth while you think about the trauma and those related feelings. During this phase, new and useful information comes up, and old painful thoughts, memories, and feelings fade and become less distressing. At the end of processing, you'll look back at the positive beliefs that you want to have about yourself. Processing is over when these positive beliefs feel true to you and there are no unpleasant sensations in your body. This phase of treatment may take several sessions. You may also work through more than one traumatic memory before treatment is over. EMDR doesn't require you to take medication. With your therapist's help, you'll follow a step-by-step program for about 3 months.
Okay. ये लाइक जस्ट नाउ इट मेंशन कि वो 3 मंथ्स के लिए है, मतलब बेसिकली क्या देखा कि वो पर्सन को ट्रॉमेटिक एक्सपीरियंस है। पहले हम लोगों ने उनको पूछा क्या नेगेटिव फीलिंग एक्सपीरियंस कर रहे हैं, रेटिंग स्केल देखा, धीरे धीरे बायलैटरल स्टिमुलेशन टेक्निक से की मदद से हम लोगों ने देखा कि वो धीरे धीरे जो ट्रॉमेटिक एक्सपीरियंस जो 0 पे था वो धीरे, मतलब जो 7 पे था वीकेंड से, वो धीरे धीरे करके 0 पे आ रहा है वैसा। सो EMDR थेरेपी एक क्विक नहीं होता है, इट टेक्स अ नंबर ऑफ सेशंस. कितने किसको कितने सेशंस लगेंगे वी विल सी अबाउट इट, बट दिस वाज ऑल अबाउट कि EMDR थेरेपी कैसे वर्क होता है.
Your therapist will act.
So yeah, there is an important announcement which ma'am will be making before we move further.
Okay. So hello everyone. So already we are making like a weekly workshops. So I'm thinking of something more. So from the next week onwards, so you will be able to see podcasts in our channel. Okay. So we'll be talking in depth. You can see like our workshop, which is already in depth. So in the podcast also, it will be in more in depth, and we'll be talking with the like therapist who has a specialization in this specific field. Okay. So most probably in the next week, it will be about sex and intimacy. Okay. And all the topics will be relevant to like your clinical thing. Okay. So like you can use those in your clinical field. So it will be all for psychologist student and the psychologist. Okay. So it's my request to that you subscribe to our channel. Okay. And comment in the comment box. This workshop will be also uploaded in the that YouTube channel. Okay. So it will really gives us motivation to bring such more initiative for you. Okay. So, okay, then you can continue. And also follow our YouTube channel, Instagram. Okay. Thank you, Atul. So
Thank
kindly
you, ma'am.
welcome. So be active in our YouTube channel. So because that will motivate us to work further to bring such more initiative for you. Okay. So I think now it is 80 subscriber, only 80 subscriber in our channel. So after that workshop, already 38 in our this session. So we are expecting that it will be 100. Okay. Okay, then move further for this workshop.
Yes, thank you, ma'am. So अब हमें पता चला EMDR थेरेपी कैसे काम कर रहा है, किस चीज़ के लिए, all that stuff. अभी मेन पार्ट, phases of EMDR. There are 8 phases of EMDR. Okay. First, history and treatment planning. Second, preparation. Third, assessment. Fourth, installation. Fifth, fourth, desensitization. Sorry, my bad. Fifth, installation. Sixth, body scan. Seventh, reevaluation. And eighth, closure. Um, we'll move to the first phase, which is history and treatment planning. Okay, the name itself suggests ki history taking hai. So this stage basically focuses largely on history taking. Um, Primary aim is to establish the possible targets for the treatment. So therapist will ask the client a number of questions about his or her past, his or her present, and also his or her about future. Client will also be asked why you are seeking help, like what is the presenting issue, what are your symptoms, and what are your behaviors, when and where you are experiencing them. ये सारी चीजें भी पूछी जाती है. Okay, so we need to ask the client all these things. Next, client will then describe ki when you ask like what is the presenting issue, symptoms, behavior, when and where you are experiencing, then client will, let's say, state an issue like I have anxiety when during public speaking basically. So the associated core belief can be identified, like I am helpless or I'm worthless. So this associated core beliefs, which will be to the core to the problem, will be identified in this stage. So therapist needs to ask the next question, like the touchstone event. Now, what is touchstone event? Touchstone event is basically when you are first when was the first occurrence of the problem basically. You need to ask the client what was the first occurrence of the problem which you are experiencing, which is the presenting issue now. Also ask the client if you can remember any other times when you have felt the similar feelings. Okay, so touchstone event can be asked. Next, during this stage, it can be beneficial to explore their mother and father's parenting styles and also any significant events which had happened during their childhood. So, like I say, from a therapist point of view, we as a future therapist, we can say like whatever comes up from them, from the client's end, nothing is insignificant, nothing is waste. Something or the other can be useful, maybe not in the present session, but in the upcoming sessions.
Yeah, चालू करना.
Yeah, next, future triggers needs to be explored. Now, what are future triggers? Like where you expect an event to occur in the future, or when you will feel the same thing again. So अगर यही सेम सिचुएशन अगर ले ले एंजाइटी ड्यूरिंग पब्लिक स्पीकिंग, अगर ये सेम सिचुएशन देयर आर चांसेस कि मुझे फ्यूचर में भी आएगा, इफ यू कैन सी कि हाँ ये सिचुएशन में, ये मंथ में, ये टाइम पे सिचुएशन आने के चांसेस है, या फिर कोई ऐसा सिमिलर सिचुएशन आएगा जहाँ पे ये जो एंजाइटी फील हो रहा है ये सिचुएशन में, वो दूसरे सिचुएशन में भी एक्सपीरियंस हो सकता है. सो वी नीड टू आस्क द क्लाइंट द फ्यूचर ट्रिगर्स एज वेल. Therapist makes a note of it. Okay. Therapist also helps client to identify the skills which are needed in order to cope with the future events. So basically हम लोग बोलते हैं ना, we need to reward our clients. This is what it is. Like it can be anything, ability to remain calm or to solve, or public problem solving skills. So it is helpful to identify the strengths, the positive attitudes, and the behaviors that the client already possesses. Like if the client is saying कि हाँ मुझे anxiety हो रहा है public speaking में, so we can ask like उस टाइम पे आप क्या करते हो? We get to know. धीरे धीरे हमें वो भी पता चलता है कि उनके पॉजिटिव स्ट्रेंथ्स क्या है, उनका एटीट्यूड क्या है, उनका बिहेवियर क्या होता है वो सिचुएशन में. सो दीज पॉजिटिव थिंग्स, दीज पॉजिटिव एस्पेक्ट्स कैन बी स्ट्रेंथन्ड एंड इट हेल्प्स अस टू बिल्ड देयर कॉन्फिडेंस टू प्रिपेयर फॉर फ्यूचर इवेंट्स. सो अगर इफ दे सेड कि फ्यूचर ट्रिगर्स, एज आई मेंशन कि फ्यूचर ट्रिगर्स नीड टू बी एक्सप्लोर्ड, जहाँ पे दे आर सेइंग कि हाँ फ्यूचर में इवेंट होने के चांसेस है. सो as we are strengthening their future, their positive points, their positive attitudes and behaviors, it helps us in gaining more confidence, to build their confidence to face the future event. So in this phase, therapist assesses the client's condition, including its ability to withstand stressful memory. हमें पता चलता है कि client का condition अभी कितना है, वो कितना ले पा रहा है, what are the positive things. We also asked about maybe with parenting styles, any childhood trauma or any significant event during childhood, not necessarily trauma, maybe a code problem, future triggers. All these things are explored in the first phase, history and treatment planning. Okay, so this was our first phase, history and treatment planning. Next, preparation phase. Now, therapist helps the client find different ways to deal with emotional or psychological stress which they are experiencing. मतलब कि हम लोग को ट्रॉमेटिक एक्सपीरियंस कर रहे हैं, वो इवेंट एक्सपीरियंस कर रहे हैं बेसिकली. सो व्हाट हैपेंस कि ये हैवी हो जाता है हम लोग के लिए, तो क्या करना क्लाइंट, तो क्लाइंट को हम कैसे हेल्प करेंगे. नाउ दिस, ड्यूरिंग दिस प्रिपरेशन स्टेज, EMDR थेरेपिस्ट विल एक्सप्लेन ये सारी चीज़ें बिफोर स्टार्टिंग विद द ट्रीटमेंट. यू आर प्रिपेयरिंग द क्लाइंट, राइट. सो हम लोग क्या करेंगे, साइको एजुकेशन देंगे उन्हें पहले तो, कि व्हाट EMDR इज, हाउ इट वर्क्स, इट्स पॉसिबल साइड इफेक्ट्स. बिकॉज ऑब्वियसली तुम लोग ट्रॉमेटिक एक्सपीरियंस करवा रहे हो क्लाइंट को, तो वो साइड इफेक्ट्स तो होंगी ना, जैसे headaches or lack of concentration or increased emotional intensity, right? So these are the possible side effects which the client may be experiencing. So psychoeducating the client first is very important. So since EMDR sessions can be intense at times, so therapist must prepare the client by teaching him or her grounding techniques to manage stress. Grounding techniques मतलब क्या कि if the EMDR therapy, मतलब अगर for example वो bilateral stimulation technique वो हो रहा होगा अभी, टू ब्रिंग बैक द क्लाइंट टू स्टेज नॉर्मल, कि वो नॉर्मल पे आ जाए, सो दैट वी कैन मेक अ नोट ऑफ इट एवरीथिंग. तो उसके लिए ग्राउंडिंग टेक्निक्स यूज करते हैं. ओके, टू मैनेज स्ट्रेस बेसिकली. सो दीज टेक्निक्स, इट मेक्स अस, इट प्रोवाइड्स अ बैकबोन टू द प्रेजेंट मोमेंट which they're experiencing, also the ability to quickly relax and feel safe again, and also to remind them, yeah, that they are revisiting the traumatic experience, they are not relieving it. मतलब हम लोग उसको सिर्फ एक बार देख के जा रहे हैं वो ट्रॉमेटिक एक्सपीरियंस, उसे महसूस नहीं कर रहे फिर से ट्रॉमेटिक एक्सपीरियंस को, उसे गुजर नहीं रहे हम लोग फिर से. basically you are revisiting, not reliving the traumatic experience. This is much important to let the client aware. So like यहाँ पे लिखा है self-soothing tools, मतलब the grounding techniques which you can use are butterfly hug, breathing techniques, emotional freedom technique, mindfulness, and the safe space. So this all can be used in between therapy sessions, in between when they are experiencing bilateral stimulation technique, between when they are feeling heavy and loaded. These techniques can be used. I'll explain one by one. First is butterfly hug technique. See here.
I got a record player that was made in 2014. Now my hair blue, came out of six sort of green. I like pictures just as when they fall. Still on my knees, I pretend I.
Okay. So basically यहाँ पे टेक्निक्स बताए थे. First, let's go one by one. Butterfly hug. Okay, this can be helpful. Next, breathing techniques. Box technique, like breathing for 4 seconds, holding the breath for 4 seconds, releasing your breath for 4 seconds, waiting for 4 seconds, again breathing for 4 seconds. So this is basically box technique, box breathing. So this is one of the breathing technique which you can use. Next is emotional freedom technique, जहाँ पे you are tapping, as you can see in the video.
I got a record player that was made in 2014. Now my hair blue, came out of six sort of.
Yeah, so here you can see.
Just as when they fall. Still on my knees, I pretend I.
So basically, you are tapping your fingers or your hands on specific parts of your body. Okay, so like on the side of your hand or on the top of your head, on the eyebrow, under your eye, under your nose. So like this. So this is one of so this is basically emotional freedom technique. This also can be helpful. So suppose if you are feeling stressed or anxious about a situation, or matlab, let's say a client is experiencing this, so you as a therapist would begin by identifying, you will tell them to identify the emotion or the issue they want to address. Then you will focus on that feeling and would gently tap on certain points of your body which I mentioned just now. So while tapping, you will ask the client to say a phrase or a positive statement. Like, even though I'm feeling anxious in this situation, I am deeply and completely accepting myself. I am feeling relaxed. So this process basically helps the client release negative emotions, to reduce stress, and also to produce a sense of calm. Okay, so these are some of the grounding techniques which can be used. So you need to prepare the client for this as well. It's basically self-taught, like they can learn on their own. But if they're not aware of these techniques, you need to tell them like this is the way you need to perform this technique if you are feeling heavy, if you are feeling loaded, if increased emotional intensity, basically. So, like, there may be occasions, right, when EMDR session cannot reach closure. Like, in other words, you can say, like, they have been unable to fully process and reprogram a target event or a traumatic memory during one session. मतलब एक ही session में how can you expect कि a client will experience the traumatic event completely और वो जो rating scale 7 to 0 आ ही जाएगा? No. So मतलब ये कब रीच क्लोजर नहीं रीच पाता, मतलब वो क्लोजर नहीं मिलता है. So there can be number of reasons, like the session has maybe will come to an end, or maybe the client is feeling tired, or maybe the client is choosing to finish early. So sometimes, so there are chances like a traumatic or a target memory basically has more layers to it than we first thought. So मतलब क्या होगा कि when the therapist realizes it, you need to tackle it. So the therapist will ask the client to move slow by slow, step by step. Like maybe start with a sound, then maybe with a smell. Okay, so until the client reaches to the experiencing a traumatic incident, a target incident. Okay, this was
Krisha,
preparation. Yes.
Krista, there is a question in the chat box. Breathing technique, kindly repeat if possible.
Yes, sure. So there is a one type of breathing technique which I do practice. So it's a box technique. So basically, it's 4 seconds. 4 seconds you are inhaling your breath. 4 seconds you are holding your breath. 4 seconds you are releasing your breath. 4 seconds you are remaining still. Again for 4 seconds you will be inhaling a breath. So this is basically box technique. ओके मतलब 4 4 सेकेंड्स का एक ऐसा बॉक्स फॉर्म हो रहा है, सो इसके लिए वो बॉक्स टेक्निक, बॉक्स ब्रीदिंग टेक्निक नाम दिया गया है. Okay, so this is one of the type of breathing technique. There are several other types of breathing technique, but it also depends ki if you can hold your breath for more seconds, slowly and gradually you can even increase the time, and it helps you to relax more.
Excuse me.
Yes.
Like when you're saying ki we should remain still, so at that time we will be breathing normal, right? Normally.
Sorry, I didn't get it. Remaining still means?
Like you said, na ki at the fourth step we will sit still.
Okay, yeah, yeah.
So during that time we will be breathing normally, or we will be holding our breath.
So सिटिंग स्टिल मतलब हम लोग जब सिटिंग स्टिल मतलब आप इनहेल भी मतलब आप इनहेल नहीं कर रहे हो ब्रेथ को, यू आर ब्रीदिंग नॉर्मली बेसिकली.
It's holding. Simply, it's holding.
No, not holding. Holding is when you are inhaling, you are holding your breath for 4 seconds. Then again for like within 4 seconds you will release your breath, and then for 4 seconds you will breathe normally.
Yes, she is asking about still. When you say this still, so she is asking about this still. Where, what do you mean by
Yes.
still?
So
Yeah,
basically,
that's
my
what I'm
understanding
saying.
says
You will
ki
be breathing
like
normally.
during, yeah, we will be breathing normal, but our focus will be on our breath only.
Yes,
Yes, yes.
yes.
Yes. Thank you.
Ma'am, one more.
Yes.
After holding, we will release the breath slowly or
Yes.
fast.
No, slowly.
Slowly,
Slowly.
definitely slowly.
Okay, okay,
In
thank you.
any breathing technique, you need to release your breath slowly. Do not focus on the seconds. But like it's said for box technique, basically for 4 seconds, if you're inhaling, so automatically for 4 seconds, you will take time to release the breath. Okay, so this is one of the type of breathing technique called as box breathing. So yeah, so this was a second phase, preparation. Psychoeducation, you will also teach them the grounding techniques, and I also mentioned which are the grounding techniques. Okay, and if they are not able to reach closure, so you will ask them to move slowly and gradually. Matlab, if they are not able to experience traumatic event or not able to reach the closure in one session, you will ask the client to move slowly and gradually, step by step. This was all about the second phase, preparation stage.
I gotta
Okay, next, third phase, assessment. Now, this assessment we will divide it into 3 parts. Sorry, just a minute. Okay, third phase, assessment. Now, this assessment phase has 3 parts to it. First, to form a picture of the target event. Second, to identify the associated negative belief. And third is to identify an alternative positive belief. Okay, so now first one is to form a picture of the target event. Now, if the target event causes you an emotional reaction in the client, okay, so you can ask the client to picture the incident. Maybe a person, a place, or an activity or a situation that causes an emotional psychological reaction in them. So that helps them in triggering their thoughts and feelings. Okay. So this image which is formed is something they avoid thinking, right? Because it brings them unpleasant sensations. So it is important to make clients remember that these thoughts are just thoughts. But if they find themselves becoming ungrounded, or let's say I mentioned earlier, like if they find it difficult to form a complete picture of the incident, then they can move step by step, as I mentioned before, to start with a sound or to start with a smell. Okay, so basically we need to form a picture of the incident. Now, once they have formed the picture in their mind, then you need to ask them to scale it on a 0 to 10 rating scale, 0 to 10 units of disturbance scale, with 0 being no effect and 10 being extremely disturbing. Yeah, now many of them will have a question, like I mentioned before, 0 to 7. Because it was in the video, I need to mention 0 to 7 to make you more understanding. But here in this phase, you will ask them to rate it from 0 to 10. 0 being no effective, like it's not a disturbing event, and 10 being extremely disturbing event. Okay, so the therapist will make a note of the rating number which the client mentioned, and also the body sensation that the client is feeling when they think about the event. So like in which body part they are experiencing any pain or a discomfort. Okay, so the therapist will also make a note of that as well. Now, some events may not have a visual image, maybe because it happened in the childhood. Because since we are also in the history taking, we are also mentioning about any childhood events, significant events which happened during the childhood. So there may be a chances that they are not able to form a visual image, but with the help of EMDR, we can still work on it slowly and gradually. We can still work on it. Maybe they won't get a clear picture, but maybe a rough idea, or maybe a glimpse about it, ki how it will be, we can identify. Like first part of an assessment stage will be achieved to form a picture of the target event. Now second is identifying the associated negative belief. So every experience we have helps us to shape our beliefs. Now, each of the traumatic experience which the client listed in their personal history will have taught them about negative, about something about themselves, or maybe about the world, even if they not have been consciously aware of it. मतलब कोई भी traumatic experience से कोई negative emotion तो जोड़ा ही होगा, मे बी खुद के तरफ से, मतलब खुद के लिए या फिर दुनिया के लिए, या फिर किसी स्पेसिफिक इंसिडेंट या किसी स्पेसिफिक इंसान के लिए. So what happens ki these are the negative feelings are associated basically. So now there are three categories of negative beliefs. First, responsibility. So basically you are feeling less unavailable, unlovable, ugly, or not good enough. Second is lack of safety, like you are feeling in danger. Third, lack of control, you're feeling overpowered, or you are unable to stand up for yourself, or you might think, or you have a feeling that no one trusts you, or you have a difficulty in trusting people. So these are the three categories of negative beliefs which we can see from the client, like the responsibility, lack of safety, and lack of control. So during this assessment stage, the client will need to identify the beliefs they have learned from target incidents. So their present day behavior and emotions may give the therapist a clue as to what beliefs they have taken from past experience. कौन से negative belief, कौन से kind of negative belief they have taken from their past experience. Sometimes though they may not be able to find a negative belief, it's difficult to them, or they may not be aware कि ये belief जो हम experience कर रहे हैं वो basically क्या है. So it's okay. That's completely fine. Negative beliefs which they are carrying themselves will slowly and gradually you will get to know in the further stages, in the further sessions of therapy. Okay. So basically, second part के assessment का to identify the associated negative belief. Next,
मैम
third, yeah,
मैम सॉरी टू इंटरप्ट
no
जो
problem.
आपने बोला कि अनएबल टू ट्रस्ट अदर्स और और फील्स लाइक कि नोबडी ट्रस्ट मी, इससे पहले वाले थोड़े पॉइंट्स मिस हो गए. और
Yeah, yeah.
साउंड वो स्मेल का वो भी थोड़ा एक्सप्लेन करना प्लीज.
Yeah, sound. So basically, okay. So you want from first. So basically, first part क्या है? Picture form करना है हमें target event का. कि हमें हम क्लाइंट को बोलेंगे कि आप पिक्चर फॉर्म करो आपके इंसिडेंट का जो आपको बेसिकली हैवी हो रहा है, साइकोलॉजिकल फंक्शनिंग पे अफेक्ट हो रहा है, ट्रॉमेटिक एक्सपीरियंस बेसिकली. हम फिर क्या बोलते हैं कि क्लाइंट को पिक्चर फॉर्म करो ना. देयर आर चांसेस ना कि एक ही गो में क्लाइंट इज नॉट एबल टू पिक्चर द इंसिडेंट. सो देयर आर चांसेस कि वो एक बार में अगर पिक्चर फॉर्म नहीं कर पाएगा तो क्या. सो वी कैन स्लोली एंड ग्रेजुअली टेक देम स्टेप बाय स्टेप. पहले साउंड एक्सपीरियंस करो वो इंसिडेंट का, धीरे धीरे स्मेल, फुल सेंसेशंस मतलब 5 सेंसरी ऑर्गन्स, फिर कोई स्पेसिफिक इमेज में भी, छोटा इमेज में भी कोई लोग रह रहे होंगे वो इंसिडेंट में, आर देयर एनीवन प्रेजेंटिंग ड्यूरिंग दैट इंसिडेंट. फिर मतलब कुछ भी, मतलब बेसिकली वी कैन टेक देम स्टेप बाय स्टेप टू मेक देम फॉर्म अ कंप्लीट पिक्चर ऑफ द इंसिडेंट. सो अगर वो कंप्लीट पिक्चर फॉर्म हो जाता है, वी विल आस्क देम टू रेट इट ऑन अ स्केल ऑफ 0 to 10. So 0 means you have the disturbance, मतलब 0 to 10 units of disturbance scale. मतलब कि 0 being no effect, मतलब वो traumatic incident, वो जो incident है हमें कुछ effect नहीं कर रहा है, to 10 being extremely disturbing. So we will ask the
Sometimes people are like they have experienced it in a such a bad way, or their memory, so they are so fearful of revising or revisiting the event that they don't even want to, you know, keep in their don't want to reframe the event in their mind. So what will then we do?
yeah, right.
तो
So
वो
basic.
बोलते कि मैं इसको सोचने से डरता हूँ, या ये और ट्रिगर होगा वो उसमें.
राइट राइट राइट. सो बेसिकली क्या होता है कि मैंने सेकेंड प्रिपरेशन फेज में ही बोला था साइको एजुकेशन, जहाँ पे हम बोलेंगे उनको ये थेरेपी किस तरह से आपको हेल्पफुल होगी, ये थेरेपी का पॉजिटिव इम्पैक्ट क्या होगा. ऑल्सो यू विल बी टेलिंग देम नेगेटिव साइड इफेक्ट्स, बट यू विल ऑल्सो बी टेलिंग देम कि ये नेगेटिव साइड इफेक्ट्स कैसे ओवरकम करेंगे हम, ये ग्राउंडिंग टेक्निक्स कैसे हम यूज करेंगे. सो अगर क्लाइंट फुल्ली रेडी है टू रीविजिट द ट्रॉमेटिक इंसिडेंट, then only you can move to the further stages. And if he is not ready yet, you can more work on the grounding techniques. Or maybe history taking में if you get to know कि if उसे maybe heart issue है or maybe dissociative disorder है, you need to consult with the psychiatrist as well. So ये चीजें पहले करनी पड़ती है हमें. आई विल लेट यू नो फर्दर, बट सिंस यू आस्क्ड द क्वेश्चंस आई एम टेलिंग यू कि ये चीजें हमें करनी पड़ती है इफ द क्लाइंट इज नॉट रेडी.
Okay, thank you. Okay.
या वेलकम. सो बेसिकली अगर हम रेटिंग स्केल में हमें पता चलेगा, सो थेरेपिस्ट विल मेक अ नोट ऑफ द नंबर. ऑल्सो हमें वी विल बी आस्किंग द क्लाइंट की द बॉडीली सेंसेशंस विच दे आर फीलिंग. मतलब जैसे मैंने पहले कहा था कि एक कोई भी नेगेटिव ट्रॉमेटिक इवेंट दे एक्सपीरियंस कर रहे होंगे, वो उसका बॉडीली सेंसेशन के साथ रजिस्टर हो जाता है, नॉट ओनली द इंसिडेंट बट ऑल्सो द बॉडीली सेंसेशन. सो विल ऑल्सो बी आस्किंग द क्लाइंट की कहाँ पे वो बॉडीली सेंसेशन हो रहा है, इन विच स्पेसिफिक पार्ट ऑफ द बॉडी दे आर एक्सपीरियंसिंग देम. ओके, बट या देर आर चांसेस कि अगर वो चाइल्डहुड में हुआ होगा तो वो क्लियर विजुअल इमेज हमें नहीं मिल पाएगा, एंड दैट इज ओके. But EMDR can still be helpful. Why? Because slowly and gradually, as you're moving from by step, at least you can give a client a glimpse of the incident. Not necessary कि पूरा picture form हो, maybe a partial picture भी form हो, but that also can be helpful. And this can be helpful with the help of EMDR therapy. ये हो गया फर्स्ट पार्ट. सेकेंड पार्ट, आइडेंटिफाइंग द एसोसिएटेड नेगेटिव बिलीफ. मतलब कि क्या है कि जो भी हम ट्रॉमेटिक एक्सपीरियंस कर रहे हैं, ट्रॉमेटिक इंसिडेंट एक्सपीरियंस कर रहे हैं, वो कोई नेगेटिव बिलीफ से एसोसिएट होता है. देयर आर 3 कैटेगरीज ऑफ नेगेटिव बिलीफ. रिस्पॉन्सिबिलिटी, मतलब यू फील लाइक यू आर अनलवेबल और अगली और यू नॉट गुड इनफ. Next is lack of safety, like simply as feeling in danger. And lack of control, matlab you are feeling overpowered for oneself, or maybe you are feeling like you're not cannot take a stand for yourself. Maybe you cannot trust others, and maybe you might be feeling like others are not trusting me. So these are categories of negative beliefs. So in this stage, you need to identify which sort of negative belief they are having, like the present day behavior and the emotions which are experiencing just now. It can give the therapist a clue कि ये कौन से टाइप का नेगेटिव बिलीफ हो सकता है. एंड अगर इफ दे आर नॉट एबल टू आइडेंटिफाई द नेगेटिव बिलीफ, दैट इज ओके. मतलब the negative belief will be experienced slowly and gradually in the other sessions of EMDR. Okay, so this was the second part. Third part is identifying an alternative positive belief. मतलब कि EMDR not only desensitizes trauma, मतलब वो हमें सिर्फ थोड़े टाइम के लिए ही रिलीफ नहीं देता है, but it also helps the client to replace the negative belief they have learned with a positive cognition. Okay, मतलब if the client is saying I'm unlovable, it will be changed to I'm lovable. I'm ugly to I'm beautiful. I'm weak to I'm strong. So this enables the client to replace these negative beliefs which they are experiencing, which they have learned, with a positive cognition. So we just need to identify, okay, for now we just need to identify which positive cognition they are associating with the negative belief. So when they have decided, okay, now this positive beliefs I'm going to take it, this negative belief I will be going ahead with, this positive belief I will be going ahead with, then as a therapist you need to ask them how much you believe it. This time you will be asking them to rate it on a scale of 0 to 7, like 0 that you're not completely unbelieving it, and 7 you are completely believing it. Therapist makes a note of the number. सो थर्ड पार्ट में क्या होता है, हम जो नेगेटिव फीलिंग्स को कर रहे हैं वो एसोसिएट करेंगे पॉजिटिव फीलिंग्स को, वो हम क्लाइंट को बोलेंगे कि यू एसोसिएट विद इट एंड चूज अ पॉजिटिव बिलीफ, एंड यू विल बी आस्किंग देम टू रेट इट ऑन अ स्केल ऑफ 0 to 7 एंड यू विल बी नोट द नंबर. दैट्स इट. अभी तक थर्ड फेज में हम सिर्फ इतना ही करेंगे. Form a picture of the target event, identifying the associated negative belief, and third, to identify an alternative positive belief. Okay? This was all about third phase assessment. Fourth, desensitization. Now, desensitization, this is the phase where active therapy takes place. It is when mind completely is processing of the target event. So now once the client is focused on the target event and is feeling its associated sensations like the bodily sensations or emotional sensations, then bilateral stimulation began. Bilateral stimulation जो मैंने पहले बोला था, eye movements, back and forth, this is basically bilateral stimulation. ये फोर्थ फेज में डिसेंसिटाइजेशन फेज में ये टेक्निक हम यूज करते हैं. बिकॉज क्यों, जब यहाँ पे टारगेट इवेंट पे एकदम फुली फोकस्ड है, यू आर फुली इमेजिनिंग अ टारगेट इवेंट, देख सकते हो पूरा इंसिडेंट, यू आर अवेयर अबाउट इट, ऑल्सो यू आर अवेयर अबाउट द बॉडीली इमोशनल सेंसेशंस, you are using bilateral stimulation. Bilateral stimulation, once again I'll revise, moving your eyes from side to side, following your therapist's hand while keeping your head still. Okay. Now, during bilateral stimulation, client will not be hypnotized. Okay. So, ये एक ऐसा मिथ होता है कि डिसेंसिटाइजेशन फेज में कि बायलैटरल स्टिमुलेशन बेसिकली ये टेक्निक अप्लाई करते टाइम देयर आर चांसेस कि वो क्लाइंट हिप्नोथेरेपी हो जाता है, हिप्नोटाइज्ड हो जाता है बेसिकली. नो, इट्स रॉन्ग. सो दे आर इन द कंप्लीट स्टेज ऑफ अलर्टनेस, अवेयर है वो, फुल्ली कॉन्शियस है थ्रू आउट द सेशन, एंड दे हैव कंट्रोल इन देयर माइंड और इन द थेरेपी सेशन कि हाँ, अगर मैं ज़्यादा एक्सपीरियंस कर रही हूँ सो मे बी नाउ आई कैन यूज द ग्राउंडिंग टेक्निक, और मे बी नाउ आई कैन टेल द थेरेपिस्ट कि येस वी कैन फिनिश आवर सेशन अर्ली लिटिल टुडे. Why? Because they're fully aware, they're fully conscious, they're not hypnotized. Okay. So each set of the bilateral stimulation, one of them asked me कि कितने टाइम तक bilateral stimulation होना चाहिए. So yes, it can last from 30 seconds to 3 minutes. So क्या होता है कि client just notices whatever comes in. Okay, एक के बाद एक जो भी होता जा रहा है, whatever comes to their mind, let it, whatever happens happen. ये 30 seconds to 3 minutes तक range करता है. And after each round of bilateral stimulation, the client takes a deep breath and then notices whatever comes to mind. बायलेटरल स्टिमुलेशन हो गया, ठीक है, क्लाइंट नोटिस कर रहा है वो बायलेटरल स्टिमुलेशन के टाइम पे कि जो भी चीज़ें आ रही है आने दो. ओके, यू आर रिविजिटिंग द ट्रॉमेटिक एक्सपीरियंस आफ्टर ईच राउंड. मतलब देयर आर सेवरल राउंड्स ऑफ बायलेटरल स्टिमुलेशन. ऑब्वियसली एक 3 मिनट में थोड़ी ना कोई ट्रॉमेटिक एक्सपीरियंस रिविजिट कर सकता है. नो, देयर आर स्पेसिफिक राउंड्स. इसके लिए वो 30 सेकेंड्स टू 3 मिनट्स क्यों देते हैं? बिकॉज देयर आर चांसेस कि वो इतना इंटेंस हो जाता है कभी कभार, इसलिए यू आर नॉट मूविंग अहेड ऑफ 3 मिनट्स, इसलिए वो 30 सेकेंड्स टू 3 मिनट्स तक ही लास्ट करता है. देयर आर सेवरल राउंड्स. सो आफ्टर ईच राउंड you will ask the client to take a deep breath, and then the client will notice कि मैंने ये 3 मिनट में क्या क्या देखा, क्या क्या सुना, क्या क्या एक्सपीरियंस किया, क्या क्या फिजिकल सेंसेशन मैंने एक्सपीरियंस किया. So these insights can then guide the therapist and also the client to make a sense of the trauma, कि हाँ trauma ऐसे था, मैंने ऐसे experience किया था उसको. So यहाँ पे neither the therapist nor the client should judge कि मेरे वो 3 मिनट के ड्यूरेशन में क्या दिमाग में आना चाहिए, क्लाइंट के दिमाग में क्या आना चाहिए. नो वन शुड, नॉर द थेरेपिस्ट नॉर द क्लाइंट. Sometimes the therapist can go into an EMDR session with rigid ideas of causes of a trauma. But yes, EMDR helps to gain new insights and connections. So like मतलब कैसा होता है कि jigsaw puzzle का pieces fit हो रहा है धीरे धीरे. So the client realizes like these life events which I've experienced are linked and everything makes a lot more sense. कि हाँ मे बी मैं अभी रिविजिट कर रही हूँ, नाउ आई एम गेटिंग एन आइडिया कि मे बी मैं उस टाइम पे वो नेगेटिव इमोशन क्यों एक्सपीरियंस कर रही थी, क्या हो रहा था, क्यों हो रहा था. मे बी वो कुछ पास्ट इंसिडेंट से हो रहा था, वो कुछ सामने मेरी चीज़ें कुछ और थी और मैंने किसी और चीज़ को देख के वो नेगेटिव एक्सपीरियंस ले लिया. So this all things the client will be experiencing and you will get an idea as a therapist, you will get an idea कि ये क्या है. So basically client को insight मिलता है, connection मिलता है, jigsaw puzzle fit होने लगता है धीरे धीरे. ये EMDR therapy bilateral stimulation technique के कारण. Okay, this
Krishna,
was
there is a question.
yes.
Does the client talk during the bilateral stimulation?
So yeah, it depends. Like if it is an emotional freedom technique, the grounding technique which I mentioned before, at that time I mentioned like yes, the client will be saying कि yes, I'm in a relaxed form even though I'm feeling negative emotion right now, I'm in a relaxed form. Yes. For bilateral stimulation, it depends. So some clients do not feel not maybe safe or they not be comfortable right now enough to speak whatever they are experiencing during bilateral stimulation. Slowly and gradually, if the client is willingly itself saying कि yes, I want to speak, or maybe वो लोग खुद से ही बोलने लगते हैं. We do not even need to say कि is it comfortable for you to speak during bilateral stimulation. No, वो लोग खुद से ही बोलने लगते हैं क्योंकि because धीरे slowly and gradually they are gaining positive insight, they're gaining positive connection. Okay.
मैम अर्लियर जो आपने बताया कि नेगेटिव बिलीफ के बाद पॉजिटिव बिलीफ वाला स्टेप है, वो हमें उनको साइको एजुकेट करना है या फिर हाउ विल वी कन्वर्ट देयर, बिकॉज व्हेन वी आर गिविंग देम टाइम लाइक वी आर डूइंग दिस bilateral stimulation, then slowly and gradually they'll the unprocessed things will be connected and everything will be settled. Then they themselves will realize ki this has impacted me and I am the mind will fit the layers and everything will be solved, and then they'll themselves come to the positive beliefs, or we have to again and again remind them, or we have to settle ourselves.
Okay, so this will be you will get an answer in the further phases. But just to give you an idea कि पॉजिटिव बिलीफ को हमें साइको एजुकेट नहीं करना है, हमें खुद को उन्हें बोलना है, खुद को रियलाइज करवाना है कि ये नेगेटिव फीलिंग के साथ कौन सा पॉजिटिव फीलिंग एसोसिएट हो सकता है, व्हाट डू यू थिंक अबाउट इट. हमें सिर्फ उनसे बुलवाना है. वी नीड टू जस्ट नो, वी एज अ थेरेपिस्ट जस्ट नीड टू नो कि उनका पॉजिटिव बिलीफ क्या है एंड उनका रेटिंग स्केल क्या होगा वो पॉजिटिव बिलीफ का. दैट्स इट. वो हम लोग प्रीवियस थर्ड स्टेज असेसमेंट स्टेज में हम देखते हैं. यहाँ पे हम क्या कर रहे हैं, नेगेटिव फीलिंग टोटली एक्सपीरियंस कर रहे हैं. यहाँ पे किधर भी कहीं पे भी पॉजिटिव फीलिंग नहीं आ रहा है. यहाँ पे बेसिकली कनेक्शन मिल रहा है कि हाँ ये ऐसी चीज हो सकता है, ये चीज ऐसी चीज हो सकता है, इंसाइट गेन हो रहा है. मे बी पॉजिटिव कनेक्शंस मिल रहा होगा बट यहाँ पे हम लोग कहीं पे भी पॉजिटिव फीलिंग या कहीं पे भी पॉजिटिव कॉग्निशन एक्सपीरियंस नहीं कर रहे. We will be experiencing in the further stages. I will be explaining it to it. I'll be explaining to you. Sorry.
Okay, thank you. Thanks a lot.
Yeah, welcome. Okay, so this was the fourth phase, desensitization. Next, fifth phase, installation. Now, when the target event has been neutralized, okay, now अभी उन लोगों ने full experience कर लिया, slowly and gradually they gain insight, slowly and gradually they start making connections, jigsaw puzzle fit हो रहा होगा. So फिर से यू विल गेट टू नो कि हाँ मे बी पॉजिटिव फीलिंग अभी हो रहा है, थोड़ा बहुत इम्प्रूवमेंट हुआ है. ओके, सो थेरेपिस्ट विल अगेन आस्क कि ये जो टारगेट इवेंट था रेटिंग स्केल पे कितना है. सॉरी. सो अगर पता चलता है कि वो टारगेट इवेंट 0 पे आ गया, न्यूट्रलाइज हो गया, नाउ इट इज द टाइम टू रिप्लेस द नेगेटिव कॉग्निशन विद द पॉजिटिव कॉग्निशन. पहले हम लोगों ने सिर्फ उनसे बुलवाया था, सिर्फ हम लोगों ने उनसे स्टेट करवाया था कि पॉजिटिव कॉग्निशन क्या हो सकता है. यहाँ पे फिफ्थ फेज पे यू विल बी बेसिकली रिप्लेसिंग द नेगेटिव कॉग्निशन with the positive cognition. So before the reprocessing process begin, the client should have selected a new positive belief. So जैसे मैंने कहा था कि न्यू पॉजिटिव बिलीफ उनको बोलना है कि आई एम वर्दी और आई एम सेफ, आई एम लवेबल. ओके, सो देर आर चांसेस कि वो जो पॉजिटिव बिलीफ वो लोगों ने बोला होगा, देर आर चांसेस कि ये नेगेटिव फीलिंग के जब एक्सपीरियंस कर रहे थे वो लोग पॉजिटिव बिलीफ में भी चेंज हो गया होगा, एंड इट्स फाइन. If the client needs to change the positive cognition, let them do it. They can install multiple positive cognitions as well. And also, if it depends if they have the time to revisit the positive cognition as well. Because ये positive cognition को भी हम experience करेंगे same जैसे हम लोग ने negative feeling को experience किया था. So यहाँ पे once they install a positive cognition, the therapist will ask a question like on a 0 to 7, how much do you believe the positive statement in relation to the original target event. So मतलब हम लोगों ने प्रिपरेशन असेसमेंट फेज में हम लोगों ने उन लोग को पॉजिटिव कॉग्निशन पूछा, रेटिंग स्केल पूछा. ओके, ये कब हुआ? जब हम लोग नेगेटिव एक्सपीरियंस क्लाइंट से करवा रहे उसके पहले, बायलैटरल स्टिमुलेशन ऑफ नेगेटिव एक्सपीरियंस से पहले. अब उन्होंने एक्सपीरियंस कर लिया, they might be changing or they might be keeping same positive cognition, same positive statement. Now again you will be asking them कि कितना rating scale क्या होगा अभी का. You will get to know कि maybe there are chances कि उनका positive cognition का उस time का scale maybe 2 होगा and अभी maybe बढ़ गया होगा 3, 4 हो गया होगा. You will get an idea कि हाँ मे बी उनका completely जो भी, because as we get to know ना कि उनका जो नेगेटिव इमोशन था, जो नेगेटिव इवेंट था, वो न्यूट्रलाइज हो गया, वो 0 पे आ चुका है डिस्टर्बेंस स्केल पे. सो ऑब्वियसली ऑटोमेटिकली यहाँ पे पॉजिटिव कॉग्निशन बढ़ेगा ही. Okay, so therapist will also ask the client to focus on the new picture, new feelings, words, or sensations of this new belief, and then begin the bilateral simulation again in the same way that they did for negative, painful old memory, we can say. So basically, जो negative memory के लिए, negative emotion के लिए हम लोगों ने किया था bilateral stimulation, same thing we will do for positive cognition as well. So each time they complete a set, you need to notice how the client will be feeling and you need to ask them how much they believe the new cognition scale on the scale of rate of 0 to 7, and you need to continuously or you need to apply the bilateral stimulation until the client selects the number 7, until the positive cognition becomes 7. You need to apply the bilateral stimulation. Okay, this thing happens in the fifth phase, installation phase. एस फोर्थ फेज में हम लोग नेगेटिव इमोशन एक्सपीरियंस कर रहे हैं डिसेंसिटाइजेशन फेज में. फिफ्थ फेज में हम लोग पॉजिटिव इमोशन एक्सपीरियंस कर रहे हैं. बोथ फेज में हम लोग बायलैटरल स्टिमुलेशन टेक्निक ही एक्सपीरियंस यूज कर रहे हैं. सो इट्स बेसिकली वन ऑफ द कोर टेक्निक. ओके,
Excuse me.
यस.
So basically, in this process, अरे मैं जो क्वेश्चन पूछने से भूल गई. I will just come back to you again.
नो प्रॉब्लम, टेक इट.
हाँ, this process will be like going on in various sessions. नहीं, एक सेशन का प्रोसेस तो नहीं होगा.
नहीं 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 नहीं.
Okay. So like when we will be leaving the client in between, तो उसके emotions तो triggered होंगे, right?
यस.
So we will be
Yes,
for
yes, go
till the
ahead.
next session. How will the client manage the emotions with the because वो हम trigger कर चुके हैं उसके emotions तो.
राइट. सो बेसिकली क्या है कि सिंस क्लोजर नहीं मिल पा रहा है एक सेशन में, नेगेटिव एक्सपीरियंस मतलब क्लोजर नहीं मिल पा रहा है नेगेटिव एक्सपीरियंस का बेसिकली. सो ग्राउंडिंग टेक्निक्स यूज होते हैं बिफोर एंडिंग द सेशन. 10 मिनट पहले बायलैटरल स्टिमुलेशन खत्म नहीं कर सकते. यू नीड टू गिव सम टाइम, लाइक एंडिंग 5 मिनट्स पहले बायलैटरल स्टिमुलेशन खत्म करना, नो. मेकिंग अ नोट ऑफ इट, नो. उसके पहले ग्राउंडिंग टेक्निक्स यूज करनी पड़ती है, सो दैट हाँ देर आर चांसेस कि घर जाके वो लोग और लाइक साइड इफेक्ट्स होंगे, जैसे आई मेंशन बिफोर कि हेडेक्स होगा, मे बी लो सेल्फ एस्टीम होगा, लैक ऑफ कंसंट्रेशन, कुछ भी हो सकता है, आई एग्री. बट व्हेन यू स्टार्ट ऑफ विद द नेक्स्ट सेशन, यू मेड अ नोट ऑफ इट कि यहाँ तक उनको मे बी बिफोर एंडिंग द सेशन यू कैन आस्क कि अगेन यू कैन आस्क रेटिंग स्केल कि हाँ मे बी डिफरेंस नहीं आया है, इफेक्ट नहीं हुआ है, ओके, यू नीड टू स्टार्ट इट अगेन. फिर से यू विल आस्क द क्लाइंट टू फॉर्म अ पिक्चर ऑफ द इंसिडेंट फ्रॉम अ स्टार्ट, फ्रॉम द बिगिनिंग, लाइक स्टेप बाय स्टेप वहां से. एंड इफ यू आर सेइंग कि क्लाइंट इज लिविंग विद द नेगेटिव इमोशंस, हम लोग ग्राउंडिंग टेक्निक्स अप्लाई कर रहे हैं, बट यू नीड टू ऑल्सो टेल द क्लाइंट टू like use these grounding techniques at home as well, because there are chances ना, because obviously chances है ही कि वो लोग नेगेटिव इमोशन लेके बाहर जा रहे हैं, तो वो लोग घर पे एक्सपीरियंस करेंगे ही, और मे बी द नेक्स्ट सेशन से पहले वो एक्सपीरियंस करेंगे या ज्यादा टाइम करेंगे. सो इसलिए तो हम लोग साइको एजुकेट कर रहे हैं ना क्लाइंट को कि ये साइड इफेक्ट्स हो सकते हैं, बट दे ऑल्सो नीड टू टेल अस ना कि उसका मे बी रिजल्ट कुछ ज्यादा ही अच्छा होगा, जो आपके फ्यूचर के लिए ज्यादा बेटर है, नॉट विद योर बिकॉज ऑफ अ प्रेजेंट, बट फ्यूचर के लिए वो ज्यादा इफेक्टिव होगा. दैट्स व्हाई वी आर साइको एजुकेटिंग अ क्लाइंट कि ये नेगेटिव फीलिंग्स एक्सपीरियंस होंगी, यू नीड टू डू द ग्राउंडिंग टेक्निक्स not only in the session itself but also at home as well, until they become fully neutralized of the negative memory. I
Krisha, there is
Yes.
one more question.
Thank
Okay,
you.
you complete. Sweta, clear?
Is it
Yes,
clear?
thank you. Thanks for that. Yes,
Okay,
Yes.
yes,
okay.
yes.
Thank you.
Okay, there is one more question. Please explain the difference between assessment, alternative, alternative positive belief, and installers.
I'm so sorry, ma'am. Could you please repeat?
Yes, please explain the difference between assessments, alternative positive belief, and installation.
Okay, so basic difference, assessment is a phase, थर्ड फेज ऑफ EMDR थेरेपी. ओके, जो हम लोग ने 3 पार्ट में डिवाइड किया है. जो थर्ड पार्ट है पॉजिटिव बिलीफ, मतलब वी विल आस्क द क्लाइंट टू फाइंड अ कॉग्निटिव टू फाइंड अ पॉजिटिव कॉग्निशन एसोसिएटेड विद देयर नेगेटिव कॉग्निशन. ओके, मतलब हमें सिर्फ उनसे जानना है कि अगर ये नेगेटिव इमोशन है तो वो ये पॉजिटिव इमोशन क्या हो सकता है, पॉजिटिव कॉग्निशन क्या हो सकता है, एंड देन विल बी आस्किंग देम कि वो रेटिंग स्केल पे रेट करो, सो दैट वी विल गेट एन आइडिया. इतना ही, ये सिर्फ असेसमेंट फेज में थर्ड पार्ट में होता है. अब जब बोला पॉजिटिव कॉग्निशन का, तो ये फोर्थ स्टेज डिसेंसिटाइजेशन है, जहां पे पूरा नेगेटिव मेमोरी, नेगेटिव इमोशन एसोसिएटेड होगा. बायलैटरल स्टिमुलेशन नेगेटिव मेमोरी के लिए यूज होता है यहाँ पे फोर्थ स्टेज डिसेंसिटाइजेशन के लिए. कब तक? जब तक क्लाइंट पूरा जीरो तक डिस्टर्बेंस स्केल में नहीं आ जाता कि द इवेंट इज नॉट डिस्टर्बिंग एनीमोर, तब तक. तो ये बायलैटरल स्टिमुलेशन नंबर ऑफ टाइम्स यूज होते हैं इन नंबर ऑफ सेशंस. इंस्टॉलेशन, दिस इज अ फिफ्थ फेज ऑफ EMDR थेरेपी, जहां पे हम लोग बायलैटरल स्टिमुलेशन करते हैं, बट नॉट विद द पॉजिटिव इमोशन, विद द नेगेटिव सॉरी नॉट विद द नेगेटिव इमोशन, बट रादर विद द पॉजिटिव इमोशन. सेम जो हम लोगों ने प्रोसेस बायलैटरल स्टिमुलेशन का किया नेगेटिव इमोशन, नेगेटिव मेमोरी के साथ, सेम हम लोग कर रहे हैं पॉजिटिव मेमोरी के साथ भी. ये हम लोग करते हैं फिफ्थ फेज, इंस्टॉलेशन फेज में. आई होप आई एम क्लियर.
Ma'am, apart from the butterfly technique and breathing technique, what all other grounding technique we can use, because the case will be so sensitive and people will be so triggered, and all these sessions will take a very long time to heal.
Yeah. So there are a number of techniques, like I say, butterfly technique, breathing technique, emotional freedom technique, which I said, tapping on different parts of your body. Next is like counting backwards, 5, 4, 3, 2, 1. If they're feeling stressed, then maybe a stress ball can be used. Also, there is a
Five,
technique. Yeah.
5, 4, 5, 4. You can explain that.
Yes,
Five,
that was I
4.
was that only I was saying just now. Yeah. So 5 finger technique, that also can be used. So these are few of the grounding techniques which you can use.
Stress ball autism like the kind of smileys we get from the market, or any
Yes, stress ball.
and we'll tell them to count backwards.
I'm so sorry. Could you please repeat? Your voice was
Five,
unclear.
four, three, 5, 4, 3, 2, 1 means we'll tell them to count, to keep counting backwards.
Yeah, means slowly and gradually the client will say 5, 4, 3, 2, 1, काउंटिंग बैकवर्ड्स. गुस्सा भी आता है ना, तो ये टेक्निक बहुत काम आता है टू काम योरसेल्फ.
Yeah. Apart from this,
I
if,
mentioned 5.
if all these are not working, I mean, means person is so much disturbed, and as a person, and him, for humanity's sake, if one also feels we have left the person and he's going disturbed home, and
हाँ.
these sessions are going to take a lot of time. So in order to heal that person, what we can do?
यस, सो EFT जो मैंने बोला था, इमोशनल फ्रीडम टेक्निक, उसका नॉट नेसेसरी जस्ट टू टैप बट ऑल्सो फॉर मसल रिलैक्सेशन के लिए भी वो हो सकता है. मतलब बेसिकली अगर कोई मसल में, मतलब कोई भी बॉडी पार्ट में, इफ यू आर एक्सपीरियंसिंग टेंशन, सो देर इज अ टेक्निक कॉल्ड एज अ प्रोग्रेसिव मसल रिलैक्सेशन, वो भी यूज कर सकते हैं हम लोग.
Any
देन
kind of any kind of relaxation technique you can use whatever in your knowledge and according to the client's comfortability. Okay, so you can use that 5, 4, 3, 2, 1, that techniques, like 5 things see around you. Okay, like your 5 sense organ you can make them use. Okay, like 4 things you can touch. Okay, 3 things you can hear the sound. Okay, 2 things you can smell, 1 thing you can taste. Okay, and JPMRC have mentioned. Okay, so like you have to see according to this situation. Okay, and it is not that the stress won't happen. Okay, it is like unavoidable. Okay, it is unavoidable, sorry. Okay, so definitely stress will happen during that situation. Okay.
and maybe not a single technique might work, a combination of techniques might work.
Yes.
So not necessary कि एक बार काम नहीं किया टेक्निक तो मतलब आगे भी काम नहीं करेगा. No, you can ask the client to experience it again, to practice it again. Maybe वो first time comfortable ना हो, second time, third time, fourth time में भी comfortable हो सकता है.
Yes, yes.
Ma'am, if possible, can you explain again installation briefly?
Yeah, installation. So basically desensitization समझा.
Yes.
या डिसेंसिटाइजेशन में क्या हो रहा है, नेगेटिव मेमोरी को हम एक्सपीरियंस कर रहे हैं बायलेटरल स्टिमुलेशन टेक्निक से. ठीक है, इंस्टॉलेशन फेज में क्या है कि हम बायलेटरल स्टिमुलेशन का एक्सपीरियंस करें बट पॉजिटिव इमोशन के साथ. जो हम लोग ने पॉजिटिव कॉग्निशन पहले स्टेट किया था असेसमेंट फेज में, वो हम अभी यूज करेंगे. वो पॉजिटिव कॉग्निशन को हम एक्सपीरियंस करेंगे बिकॉज नेगेटिव इमोशन, नेगेटिव मेमोरी जो था वो न्यूट्रलाइज हो गया, जीरो पे आ गया, जीरो डिस्टर्बेंस स्केल पे आ गया. बट व्हाट अबाउट पॉजिटिव कॉग्निशन, हम लोग को वो तो यूज करना है सो दैट इन फ्यूचर अगर वो एक्सपीरियंस करेंगे सो दे विल बी लुकिंग एट इट फ्रॉम अ पॉजिटिव कॉग्निशन पॉइंट ऑफ व्यू बेसिकली. तो जो हम लोगों ने फोर्थ स्टेज डिसेंसिटाइजेशन में बायलेटरल टेक्निक यूज किया था, सेम यहीं पे भी यूज करेंगे बट वी विल बी यूजिंग इट विद पॉजिटिव मेमोरी, पॉजिटिव कॉग्निशन बेसिकली. And we need to continue doing this until the client achieves the scale of like this number of a 7 basically. I hope I'm clear.
Yeah,
Did you
yes,
understand?
ma'am. Yes, ma'am. Yeah, I understand, ma'am.
Okay, okay, great. So this was fifth phase installation. Moving to sixth phase, body scan. Now, body scan is the final check to ensure that the target event which they have been fully experiencing, it has been decentralized, it has been reprocessed, reprogrammed, everything. So body scan, ये एक final check होता है. मतलब to perform the body scan, the client needs to breathe slowly, get into a relaxed, grounded state. Then they have to think of the original target event and they need to scan their body from head to toe. सो मतलब ये स्टेज पे क्या होता है कि द क्लाइंट्स आर ऑफन टायर्ड एंड रिलैक्स्ड, कि मतलब नॉट रिलैक्स, दे बेसिकली टायर्ड. सो मतलब हमें पता चल जाता है कि हाँ मतलब वो टायर्डनेस दिख के आता है उन लोग के बॉडी पे, बिकॉज दे आर एक्सपीरियंसिंग द नेगेटिव मेमोरी. वो उसको बाहर निकलने के बाद वो पॉजिटिव मेमोरी भी एक्सपीरियंस कर रहे हैं, तो वो पता चल जाता है टायर्डनेस इन देयर बॉडी. So what happens ki it is easily noticeable basically. So if any negative emotion, tension or physical sensations occur again while you are doing the body scan, you need to again apply a 30 seconds of or 30 seconds to 3 minutes of bilateral stimulation and again help scan their body. सो दैट अगर किधर भी फिर से अगर नेगेटिव इमोशन एक्सपीरियंस हो रहा है, मे बी सेम और मे बी डिफरेंट, तो फिर से बायलेटरल स्टिमुलेशन यूज हो सकता है. एंड अगेन यू नीड टू स्कैन देयर बॉडी. So you need to do the same for positive belief as well, and you need to look for areas of tension where they might be holding back from fully accepting the negative positive cognition. मतलब कि अगर कहीं पे भी वो लोग अटक रहे होंगे वो पॉजिटिव कॉग्निशन को कंप्लीटली फुल्ली एक्सेप्ट करने से, 7 रेटिंग स्केल तक पहुंचने से में भी वो लोग नहीं कर पा रहे हैं, तो यू नीड टू आइडेंटिफाई दैट एरिया ऑफ टेंशन. So when the client can think about the target event without experiencing tension in their body, then the processing is complete. Okay, so this is body scan. Desensitization हुआ, installation हुआ, body scan. Now we can see that the processing is kind of complete. Let's see further. Seventh, closure. Now this is the end of the EMDR session should bring a sense of closure, right? So this is chiefly a time when you like as a therapist you get to relax after all the work you have done. So the therapist will ask the not allow the client to leave their office feeling worse when they came in, right? So this is a good moment when you need to summarize, like you need to acknowledge, you need to reward, we can say there about what the client has achieved, what the efforts they have taken to come out of it. So the therapist stabilizes the client using the self control techniques like the grounding techniques which I mentioned in the phase 2 preparation phase. Okay. Therapist also explains what the client can expect between the sessions, and also is encouraged to keep a log of thoughts or emotions, to make a note of it, the behavior changes that they are experiencing when they come up in the next meeting. मतलब देर आर चांसेस कि तभी अचीव हो गया, तभी रेटिंग स्केल हो गया 7 पे पहुंच गए, पॉजिटिव कॉग्निशन न्यूट्रलाइज हो गया, नेगेटिव कॉग्निशन 0 पे भी आ गया, ओके ग्रेट. बट व्हाट इफ कि एवरीथिंग इज डन एंड मे बी आफ्टर अ फ्यू डेज they might be experiencing again. So you need to ask the client to make a note of it everything, so that when they come up in the next meeting it can be like we can do the bilateral stimulation again, and we can get to know where to and when, how to focus it on, like how to treat it basically.
Once we have told them we are doing the body scan, we'll tell them to focus on the thoughts for 30 seconds. And then if the negative emotions are there, then we'll again use the installation bilateral technique. And then again we'll do the body scan.
No. So initially only you just missed a point. Ki body scan is basically you will be experiencing your body, you're not experiencing your thoughts. यहाँ पे thoughts कहाँ पे भी काम नहीं करेंगे. यहाँ पे तुम लोग बॉडी में देखोगे कि मुझे कहीं पे पेन हो रहा है कि नहीं. एज ए मेंशन अर्लियर कि जो ट्रॉमेटिक मेमोरी, नेगेटिव मेमोरी होता है वो फिजिकल सेंसेशन से रिलेटेड होता है. सो जो भी फिजिकल सेंसेशन और एक्सपीरियंसिंग इन योर बॉडी पार्ट्स, यू विल गेट टू नो कि हाँ मतलब वो नेगेटिव मेमोरी में एक्सपीरियंस कर रही हूँ तो मे बी हैंड में मुझे दुख रहा है, मे बी मेरा सिर दुख रहा है, क्या हो रहा है. सो ये बॉडी स्कैन में पता चलेगा कि पूरा न्यूट्रलाइज हो गया, नेगेटिव मेमोरी पॉजिटिव मेमोरी भी पूरा 7 पे आ गया रेटिंग स्केल पे. सो बॉडी स्कैन पे एक फाइनल चेकअप हो जाता है कि इज देयर एनीथिंग रिमेनिंग और नॉट, एंड इफ इट इज स्टिल, इफ देयर इज सम टेंशन और नेगेटिव एक्सपीरियंस is still left to treat with, you can again do the bilateral stimulation as you mentioned just now.
Emotional freedom technique, if you can please explain, I'll be much grateful.
Yeah, so emotional freedom technique is basically tapping your two fingers or tipping your full hand on the parts of specific parts of a body, maybe your head, maybe your in the back of your ears, on the cheeks. So matlab, this technique slowly and slowly when you're experiencing, when you're completely into this, so the pain which you are experiencing in the body parts, slowly and gradually it will calm down.
Okay, thank you so much. Thanks a lot.
Yes, welcome. So this was a seventh phase, closure, and the last phase, reevaluation. So in this last step, the client will be required to rate their progress after these sessions. So in this phase, basically the effectiveness of the previous treatment is checked. So मतलब पहले की treatment effective हुई नहीं हुई, progress कितना हुआ, this all we need to make a note of it. So EMDR practitioners should always start with a session by asking the client like what changes they have noticed since their last session. Not necessarily ये सिर्फ 8th phase पे हो सकता है, ये every new session जब आप start कर रहे हो उसके पहले you need to ask the client like have they noticed any changes from the last session or not. So keeping a record of such things, whatever happens, like either good or bad, in between therapy sessions, will help the to see the changes the EMDR therapy is having. So it can be a source of a much needed, let's say, a motivation or even a guide to which needs to be worked on, basically. So for example, let's say you may notice yourself handling a situation in a better way, and that the trigger doesn't feel as intense as it previously was, but some other negative thoughts and images keep coming up, or maybe another new target keep coming up. So the therapist will also identify the additional traumatic effects that affect the target. So basically there are chances कि इसके related में भी एक नया target, नया negative target भी दिख के आए. नॉट नेसेसरी कि वो हो गया, वो टारगेट इवेंट अचीव हो गया, डन, न्यू टारगेट अचीव हो सकते, न्यू टारगेट दिख सकता है हमें. अगेन यू नीड टू स्टार्ट द प्रोसेस. Okay, these were all about 8 phases of EMDR. I hope I'm clear. If at all you have any doubts, please do ask before we move further.
Ma'am, can you explain again body scan?
Yeah, body scan. So basically, you need to ask the client to breathe slowly. You need to make them relax to in a full grounded state. Basically, मतलब grounding techniques use करोगे to make them relax. Okay. So
Okay.
yeah. Okay. So then when they are thinking about the target event, we will be asking the client like when you're thinking about the target event, is there any body pain or is there any pain which you are experiencing in a specific body part from head to toe. So you will be scanning your body when you are thinking about it, but you are not completely immersed in your thoughts, in your negative or positive emotions. Okay, you're just thinking about it. You will get to know कि हाँ ये नेगेटिव इवेंट के कारण कहीं पे मुझे बॉडी पेन या कहीं पे फिजिकल सेंसेशन एक्सपीरियंस हो रहा है कि नहीं हो रहा है. Yeah. So अगर कोई नेगेटिव सेंसेशन कहीं पे छूट जाता है, you will get to know it, and if you get to know it, then you need to do bilateral stimulation again, and then ask the client again to scan their body. So until they become fully neutralized कि हाँ हमें कहीं पे भी बॉडी स्कैन के कारण हमें उससे पता चलता है कि कहीं पे भी बॉडी में पेन नहीं हो रहा है, फिजिकल सेंसेशन एक्सपीरियंस नहीं हो रहा है, न्यूट्रलाइज हो गया, डन.
Okay,
And in
ma'am.
case
Noted. Thank you.
and in case of closure, ma'am, we'll ask ki what are the changes they have seen in themselves after the since the last session, and when they are coming up again, and if any other negative emotions are or any negative, can you please say that?
या सो बेसिकली कि यहाँ पे क्या होता है कि फर्स्ट ऑफ ऑल यू विल रिवॉर्ड द क्लाइंट कि यस यू एक्सपीरियंस दिस इवेंट, यू हैव अचीव्ड इट, यू विल एक्नॉलेज देयर एफर्ट. ओके, फिर बाद में क्या होगा कि वो ग्राउंडिंग टेक्निक्स भी यू विल आस्क देम कि टू यूज इट फर्दर इन द फ्यूचर एज वेल, एंड यू कैन मे बी यूज इट राइट नाउ लाइक इन द 7th phase of it as well. Also you can like, yeah, so what I said is like you can ask the client like when they come up for the next session, there may be chances कि अभी पूरा अचीव हो गया, बट मे बी थोड़े दिनों बाद देर आर चांसेस कि वो फिर से हमें ट्रिगर कर रहा होगा. So you will ask the client to make a note of it, the body pain or the thoughts, emotions, body behavior changes which you are experiencing before they come up to next session. So basically यहाँ पे बहुत ज़्यादा गैप हो जाता है. मतलब रीवैल्यूएशन जो 8th फेज है और 7th फेज मतलब क्लोजर का, ये दोनों फेज के बीच में बहुत गैप हो जाता है. सो दैट इवन यू आस्क द क्लाइंट टू रिविजिट योर माइंड, कि काम डाउन योर माइंड, यू विल गेट टू नो कि वो वर्क हुआ कि नहीं, और फिर हम लोग रीवैल्यूएशन में पूछ लेंगे कि प्रोसेस हुआ कि नहीं. बेसिकली ये हर एक सेशन में होना चाहिए. यू नीड टू आस्क द क्लाइंट कि कुछ प्रोग्रेस अचीव हुआ कि नहीं हुआ है. सो विल गेट टू नो कि EMDR कितना काम कर रहा है, नहीं कर रहा है, किधर अटक रहा है हमारा.
Ma'am, you mentioned that the target event might be settled, but then another something might be created.
Yeah,
That
so that point basically कि if reevaluation phase में ही था वो, कि अगर हमें पता चलता है कि इफेक्ट मतलब वो ट्रीटमेंट अचीव हो चुका है, वो टारगेट इवेंट अचीव हो गया, क्लियर्ड, एवरीथिंग क्लियर्ड, बट मे बी ये जब नेक्स्ट सेशन में आ रहे होंगे उसके पहले उन्होंने कहीं पे न्यू टारगेट, न्यू नेगेटिव मेमोरी एक्सपीरियंस किया, मे बी पहला होगा, पास्ट का होगा, और मे बी प्रेजेंट का भी हो सकता है, देन यू नीड टू अगेन गो थ्रू ऑल दिस फेजेस अगेन.
Ma'am,
thank you,
can you
ma'am.
explain?
Yes, go ahead.
Ma'am, can you explain RAM, rapid eye movement again? Uh,
Okay. REM, it is a stage of a sleep. It's a basically deep sleep से भी deep हो जाते हैं, जहाँ पे you experience vivid dreams, your brain is active. So मतलब वो हम लोग बोलते हैं ना, सपने में ऐसा आया कि हम लोगों ने किसी को पास्ट में कोई तो था, उससे हम लोग ने मिले सपने में, मे बी लाइक vivid dreams like you're flying, you're maybe doing a magic. So ये REM sleep में होता है. That is basically rapid eye
so ma'am,
movement.
it's connected to lucid dreaming
Sorry,
also.
it's connected to
Lucid dreaming. Lucid dreaming.
lucid dreaming.
Yeah.
Yeah, we can say ना, because you're experiencing vivid dreams ना. So
Yes,
मतलब
ma'am.
यहाँ पे पूरा ड्रीम ही एक्सपीरियंस करो, जो भी ड्रीम्स आती है वो REM स्लीप में आती है.
Ma'am, can you please show the slide where it was all drawn on the stages?
Yeah, sure. Done?
Thanks a lot, ma'am. Thank you.
Welcome.
Hello,
Okay.
ma'am. I
Yes.
have a question.
Yes,
So,
please.
you mentioned that when we are done with one memory, when we are done processing with one traumatic memory, so there is a possibility that other traumatic memories can also get triggered, right?
Yeah.
So it means that if, let's say, if there is a person, because I've had such a client in the past, where the
Mm-hmm.
client had multiple traumas from the
Okay.
age of 4 or 5 till the age of 15, 16. So it
Hmm.
was like sexual abuse, emotional abuse, physical abuse, emotional abuse. And so it means that there are a lot of multiple events that has occurred. So if we are using EMDR, so let's say if there are 10 or 15 events, so we have to administer EMDR for every single event. Is that what we have to do over here?
Yes. So you will pick up one traumatic event. You will be asking the client. Basically, हम लोग कैसे client से normal counseling session में पूछते हैं कि कौन से problem पे पहले
Mm-hmm.
काम करना है. तो यहाँ पे
Mm-hmm.
भी हम पूछेंगे कि कौन से traumatic experience पे पहले काम करना है आपको.
Mm-hmm.
Maybe bullying का, sexual abuse क्या है.
Mm-hmm.
You will work on that. After you achieve
Mm-hmm.
that, even the client will feel confidence कि ये एक traumatic event में achieve कर गई, तो there are chances में बाकी के जो traumatic multiple traumas basically है वो भी achieve
Mm-hmm.
कर जाएंगे. So increase in
Mm-hmm.
confidence हो जाता है वहाँ पे. And so
Mm-hmm.
basically एक एक traumatic experience को आपको वो use करना पड़ेगा, मतलब एक एक उसको लेना पड़ेगा. Not necessary you can go ahead with multiple traumas and go through all these 8 phases.
Mm-hmm. Yeah, understood. I mean, because it is going to take a lot of time to go
Yes.
through every single episode of trauma in the therapy.
या सो
Okay.
ऑब्वियसली ये मैं
Mm-hmm.
एक्चुअली नेक्स्ट स्लाइड में बोलने वाली थी. नेक्स्ट पॉइंट मेरा वही था कि बिकॉज सिंस मल्टीपल ड्रामास होते हैं, ज़्यादा टाइम लगता है. सो ऑब्वियसली
Mm-hmm.
डिपेंड्स कि इज द क्लाइंट विलिंग टू स्पेंड दैट मच मनी, लाइक इज ही
Mm-hmm.
एबल टू, लाइक फाइनेंशियल कंसिडरेशंस भी आ जाता है ये टाइम पे.
Yes.
एंड यूजुअली एक थेरेपी वंस अ वीक और एवरी फोर्टनाइट होता है. इट डिपेंड्स कि
Mm-hmm.
कितना चाइल्ड प्रोग्रेस कर रहा है. मे बी यू कैन टेक
Mm-hmm.
अ वीक, देन मे बी जब मैंने बोला था कि क्लोजर और रीवैल्यूएशन के बीच में यू कैन कीप अ फोर्टनाइट का टाइम बेस्ट.
Mm-hmm.
सो ऑब्वियसली वो डिपेंड करता है कि इज क्लाइंट विलिंग टू वर्क ऑन द नेक्स्ट ट्रॉमा एज वेल और नॉट.
Mm-hmm. So let's say the client has stopped taking sessions after their first traumatic event because of some financial issue they are not able to afford the next few sessions. So let's say if they have taken a gap period of 6 to 7 months and after that they want to resume the session, so we can work on
Yeah, we
that,
can.
right?
Yes, because it is completely new traumatic event.
Mm-hmm.
Yes.
Okay, and what if client, I mean, during any phase, let's say during third or fourth phase or fourth or fifth phase, due to some personal commitment, the client is not able to attend the session and there is a huge gap, let's say 3 4 weeks का gap हो गया है यहाँ पे. So
Hmm.
will it work, or there will be some problem that we are going to face in the future sessions?
Yes. So first of all, it depends on individual to individual. थ्री
Mm-hmm.
टू फोर सेशंस का अगर गैप हो जाता है, इट
Mm-hmm.
डिपेंड्स कि अगर क्लाइंट इज रेडी टू गो थ्रू द प्रोसेस अगेन, वी विल आस्क द रीजन कि क्यों इतना टाइम का
Mm-hmm.
गैप हुआ था, इज देयर अ स्पेसिफिक रीजन, नॉट
Mm-hmm.
बेसिस कि ये नेगेटिव एक्सपीरियंस हुआ है इसके लिए किया, बट मे बी पर्सनल
Mm-hmm.
कमिटमेंट्स का भी. सो वट एवर द
Yes.
रीजन माइट बी, वी विल बी आस्किंग दैट फर्स्ट. देन इफ द
Mm-hmm.
क्लाइंट इज रेडी टू revisit the traumatic incident again, so you
Mm-hmm.
will again be using the bilateral stimulation. Yes, it is effective. It is more effective if it is done once a week or every fortnight.
Okay, so what you're trying to say is that we have to start. I mean, first is the history taking, so we don't have to do that. So we have to start from the second stage. Is that what you are trying to say?
सेकेंड स्टेज बेसिकली वो प्रिपरेशन था जहाँ पे साइको एजुकेशन देते हैं हम एंड
Mm-hmm.
ग्राउंडिंग टेक्निक्स बताते हैं उन लोग को, हाउ टू यूज दिस ग्राउंडिंग टेक्निक्स एंड व्हेन टू यूज इट. सो वो
Mm-hmm.
फेज नहीं आता है.
Mm-hmm.
बेसिकली वो डिसेंसिटाइजेशन का फेज ज्यादा रहता है. असेसमेंट में भी देर आर, इट डिपेंड्स कि अगर असेसमेंट में पूरा हो जाता है, लाइक दे आर एसोसिएटिंग द नेगेटिव बिलीफ टू पॉजिटिव बिलीफ, इफ दे आर रेडी टू डू इट. सो
Mm-hmm.
मतलब वो फेज अचीव हो चुका है हमारा. सो बेसिकली उनका डिसेंसिटाइजेशन में देर आर चांसेस की द क्लाइंट में टेक अ नंबर ऑफ सेशंस.
Mm-hmm.
Hmm.
Okay. And the last question is, as you
Yes.
mentioned, that because of some reason, if the let's say session is not completed, हो सकता
Yeah.
है client is tired or they're experiencing some or the other issue. So
Yeah.
we are going to handle that thing with those uh, coping mechanism that we have discussed. So that is
Yes.
the only thing we are going to do.
या बिकॉज यहाँ पे एक स्ट्रेस मेंशन होता, स्ट्रेस एक्सपीरियंस होता है, एंजाइटी एक्सपीरियंस होता है क्लाइंट में.
Mm-hmm.
वो एक तो इसलिए वी आर यूजिंग दीज ग्राउंडिंग टेक्निक्स.
Mm-hmm.
ऑब्वियसली इट डिफर्स. ये EMDR थेरेपी कैन बी यूज इन कोलैबोरेशन विद अदर थेरेपी टेक्निक्स एज वेल, बट इट ऑब्वियसली
Mm-hmm.
डिपेंड्स कि क्लाइंट का एक्सपीरियंस क्या है. मे
Mm-hmm.
बी वो खुद के लिए ना हो, पूरा एक फैमिली के लिए हो, और मे बी वो एसोसिएट होगा किसी पर्सन से, वट एवर एक्स वाई
Mm-hmm.
जेड. So EMDR therapy can be used with some other type of therapy as well. But yeah, there is a difference.
Mhm.
Yeah.
Exactly. Because I was wondering, what if, it triggers a really intense emotion, because it can be dangerous to leave the client like that, with those emotions and
Yes.
waiting for like next 4 5 days after the next session. So it can be
Yeah.
dangerous. So is it possible, let's say tomorrow I mean, today we are having a session and due to some reason we have to interrupt the session. So can we do it tomorrow? Can we complete the session tomorrow? We have to wait for like 1 week.
Um, Actually it depends obviously first of all the client, कि
Mm-hmm.
अगर तुरंत कल करने के लिए रेडी है, if his
Mm-hmm.
body, if his physical body is ready to do it, to revisit the trauma event.
Mm-hmm.
बिकॉज देर आर
So,
चांसेस
okay.
टायर्डनेस दिखने में आ जाता है बिकॉज यू आर
Mm-hmm.
रिविजिटिंग, भले वो इंटरप्ट हुआ हो या ना हुआ हो. दैट्स व्हाई वी
Mm-hmm.
से कि वो एक वीक का गैप होना चाहिए. बट इफ द क्लाइंट इज रेडी, यू कैन डू इट टुमारो. बट सिंस यू
Mm-hmm.
आर डूइंग इट कंटिन्यूसली और द नेक्स्ट डे और द consecutive days, there are chances कि it will be effective only for a few specific period of a time and you will not get to note the changes, like after a certain
Mm-hmm.
period of time कितना change हो रहा है कि नहीं हो रहा है, if they are experiencing again or not.
Mm-hmm. Because since the client is, let's say the client is experiencing panic attack because of these emotions. So I feel, I mean, you tell me, is it necessary to complete the session next day, or we should wait for 1 week?
Uh, I think like it's not necessary to do it the other day. As I mentioned, कि वो tiredness आ जाता है. The client is not ready, and maybe if you are revisiting the event through bilateral stimulation, not necessary कि वो progress होगा ही.
So we should focus on the symptoms they're experiencing, let's say. So,
Yes, yes.
okay.
So obviously it depends on individual. If he is
Hmm.
ready to do it, and if he's very near to maybe getting neutralize the traumatic event, you can do
Hmm.
it within maybe 2 days to 3 days.
Hmm. So
Yeah.
even if we can't do it next day, we can work on the symptoms they're experiencing and we can work on that during the
Yes,
meeting.
yes, 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 yes. We can do it.
Okay. Thank you so much.
Yeah, welcome.
Ma'am, in case of as you
Uh, Priyanka,
yes,
I think let her finish the everything, then you can ask because it's in stuck and already it's becoming 9 p.m. and people
Okay.
are also like messaging me that session should complete. Then can ask the question. Okay.
Yeah,
yes,
please ask the question in the end so that I'll just complete it. So those who can wait, they can wait.
okay,
Yeah.
okay.
Yeah. We just have two to three slides left. So basically, many of them ask like how many sessions or how often long this it should take and everything. So basically, most of the therapists they recommend like around 6 sessions of EMDR. Also, yeah, severe trauma can take around 15 sessions as well. Multiple traumas may need obviously more. Single traumas which have occurred in a healthy adulthood can be resolved in few 3 to 4 sessions. But if it happened during childhood, probably it will take more time because you're not experiencing, you're not visualizing the image very clearly, so it takes time. So there is no rule, everyone is different, and healing takes as long as it takes. So most clients have EMDR therapy once a week or every fortnight. So the frequency of EMDR sessions may be influenced by the client's financial considerations, as I mentioned before. So it is essential to allow adequate breaks between the sessions to give the client's mind the time to process and to recover. So the amount, frequency, length of EMDR sessions should be down to the individual, and so we will get to know like when the client has reprocessed a trauma and it's time to end the session. Okay. Lastly, the side effects which I mentioned. So basically, yeah, during EMDR therapy, your brain is working hard. Many connections have been made. You are discarding the memory, and you are creating a new positive belief. So it can be draining, more incredibly draining, having to revisit the past that we have been avoided for so long. So, as I mentioned before, like there are side effects like headaches, lightheadedness, spaced out feeling, dizziness, tiredness, exhaustion. Also, there may be symptoms of anxiety, anger, or depression after 3 to 4 days following a session. But and also with anyone with a heart condition, eye problems, pregnant women should consult with a doctor or a therapist before starting with EMDR therapy. And also those who have dissociative disorders, we need to consult with a psychiatrist, trauma specialist as well. And therapists need to screen dissociative disorders before the treatment begins, and if it is present, then they may take more time to work on grounding techniques. And lastly, I had mentioned that you can take a fractation approach. So fractation approach is basically, I mentioned earlier, like you can break down the larger issue in a smaller traumatic experience. So basically पूरा incident अगर form नहीं हो रहा होगा तो हम step by step जाते हैं. So that is basically a fractionation approach. This you can use it, like the sensations, then the images, then the beliefs, then the cognitions. So slowly and gradually you can go about it. So clients process each component individually, allowing for a gradual healing. So these side effects can be dealt like this. And conclusion, so basically it has an outstanding effect on PTSD and other consequences of trauma, and also helps with alcohol addiction and phantom pain. Phantom pain is basically the sensation of a pain in a body part that is no longer physically present. So मतलब कि वो पार्ट रिमूव हो चुका है, मतलब जब वो पार्ट था, वो जो हम लोग पेन एक्सपीरियंस कर रहे थे, वी थिंक दैट वी आर एक्सपीरियंसिंग इट स्टिल नाउ, इवन दो इट हैज बीन स्टिल रिमूव्ड. ओके, सो ये फैंटम पेन है जो EMDR थेरेपी इसमें भी यूज हो सकता है. सो इट टेक्स अ लॉट ऑफ टाइम to be successful. Like we can say this, building relationships, preparing and stabilizing the patient are or the client are essential. So hence EMDR has been proven to be one of the most effective methods of treating trauma. So by reorganizing the memories and you connect the hemispheres of the brain, patients can process what they have been experiencing, you can lower their stress levels, and then it completely even dissolve the trauma. Okay, so this was all about today's session. This was basically EMDR therapy. I will be taking out doubts. But first of all, those who are leaving, please do subscribe to our YouTube channel and also follow us on Instagram to stay updated. Okay.
Yes, one more thing I want to add that you can share your LinkedIn ID with me, or you can just follow in the LinkedIn. So we'll be sharing the pictures of the today's session, and if I would like to mention you all who have attended this session. Okay. Thank you, Shweta. Yes, definitely would love to get the feedback.
Yes, please. Yeah.
Okay.
Ma'am, did you share the Instagram link and YouTube link on the chat
Yes,
in the chat box?
yes. I'm sharing again.
Yeah.
You answered the question. If anyone have any.
Does anyone have any questions?
Yes, ma'am, I wanted to ask, as you mentioned, we have to convert somewhere in the negative beliefs into the positive belief. For example, as you mentioned, ki there is a case of physical abuse. And can you give some examples if a lady has suffered that kind of trauma or something? What all we can say to convert the negative thoughts to positive belief? And in case of accident as well.
Um, could you repeat it? Like I missed the some part of it. I'm so sorry.
Some suppose a lady has what can we say? Like you mentioned ki we have to tell them to think something positive in the with regard to the negative thought they are thinking. So what are we going to tell them in case of a lady who has suffered a physical abuse, say sexual abuse or something, and in case of accident or some kind of heightened very negative emotion, and there was no as you mentioned psychological support. What I don't know the term you mentioned, ki no sir, that
Mental
the
resources.
yeah, mental resources was the person was alone that time, and that was a very long time.
Yeah.
So
So, positive cognition, that's what I mentioned earlier. Like, it's not necessary कि client, first of all, client will maybe ये भी पता नहीं होगा कि वो negative emotion क्या है which they are experiencing right now. If they're not even aware कि वो experience क्या है negative emotion, they cannot even state with the positive emotion. So first you need to make them aware कि जो negative emotion वो experience करे वो क्या है. You need to make them aware. And slowly and gradually you can take the client की to associate it with the positive cognition. एंड जो लैक ऑफ मेंटल रिसोर्सेज थे पहले सो नॉट नेसेसरी वो अभी हो आई अंडरस्टैंड बट because of this process with the help of this process you can get the client back to normal state and you can tell them like जो एक traumatic experience वो लोग पहले कर रहे थे नेगेटिव वे में वो might be कि वो अभी वो नॉर्मल में हो एंड वो उतना नेगेटिवली ना देखे पॉजिटिवली देखे सो दैट्स द रीजन वी आर एसोसिएटिंग इट विद द पॉजिटिव बिलीफ
yes, that I understood. The
या
theory and everything, that part I have understood. I am
या
just asking some examples like positive cognition in terms of a case where a lady has suffered that. What are we going to example in terms of the what are we going to tell that person to think or associate with the positive feeling? What kind of positive feeling one can associate with?
ओके सो देखो लैक ऑफ मेंटल रिसोर्सेज में पता चल जाता है कि एज ए मेंशन 3 टाइप्स ऑफ मेंटल लैक ऑफ मेंटल रिसोर्सेज हो सकते हैं सो यू विल गेट टू नो हिस्ट्री टेकिंग में ही कि कहाँ पे वो है कौन सा लैक ऑफ मेंटल रिसोर्सेज है फिर जैसे पॉजिटिव कॉग्निशन यू आर टेलिंग मी सो you don't provide the positive cognition to your client the client itself comes up with the positive and you are saying कि वो abuse का अगर हुआ हो so might देखो since it's a traumatic experience it's a very intense experience so वो जब desensitization phase आ जाता है, negative experience जब वो emotion कर लेते हैं bilateral stimulation के कारण, you will get an idea कि मतलब the client itself will get an idea. That's what I mentioned in the 5th phase installation कि अगर positive cognition नहीं मिल पा रहा है उनको, तो वो desensitization phase के बाद उनको अपने आप मिलेगा. And you are telling कि ये sexual abuse का it also depends on the client, the individual कि वो किस type का था, उसका history taking के ऊपर, it all depends on that. I cannot say directly कि यही एक positive belief हो सकता है.
Okay.
Is there anyone?
It was really very informative session. Thanks a lot.
Thank you so much.
And like this will be available on YouTube also?
Yes, it will be
Okay.
uploaded on YouTube. Within few days, yes, it will be uploaded.
Okay,
So
okay.
the links have been mentioned in the chat box. So once you subscribe and the bell button, when you just click on it, you will get a notification that yes, it has been uploaded. And also it will be informed on the group as well.
This part is left unclear to me because I am an advocate as well. So I have, I have come up with, we come across these citation and all. We have seen so much happening around. I just wanted to, what kind of that, because a person who is in such a guy who has faced all this wouldn't be able to themselves come to a positive cognition or positive belief system. We have that is why they have come to us, no, for mm, for kind of help or something, and for putting their mind. And if we are not able to tell that, or we are not able to to retract them to positive side, so that is why I'm asking ki what are we supposed to how are we good, what, yeah, I just want to hear an example, like what can we say, or what kind of thought we can create, and we can ask them to revisit, and we can put install in their mind. That is what I want to ask.
Okay, so since okay, I mentioned before like individual पे होगा, but since you are insisting कि कुछ example दे, so maybe we can first of all empathize with the client. Normal counseling sessions में हम कैसे करते हैं? We empathize with the client. Ki yes, and then maybe we can tell them you're telling about specifically positive cognition, so we can ask them ki what do you think. First of all we will ask them, and if you want कि हम लोग ही बोले, so maybe you can tell ki yes, you have been experiencing this sexual abuse. I completely understand, but yes, there are chances ki that event might not occur in the future. Like what will you do it if it occurs in the future? So that's what I mentioned in the first stage ना कि उनका पॉजिटिव हम स्ट्रेंथ्स भी ले लेते हैं. Based on that हम उन्हें बोलेंगे कि अगर वो एक्सपीरियंस हम फिर से करेंगे तो क्या, सो विल गेट एन आइडिया. ठीक है. फिर अगर पॉजिटिव कॉग्निशन पे देखा जाए तो आई फील लाइक डायरेक्ट पॉजिटिव कॉग्निशन नहीं हो सकता है. Like I myself I'm unclear about it. Ma'am, could you please help me?
Yes, sorry, I didn't miss the question. Can you ask me again? Sorry.
Yeah, so basically she's saying कि if someone is experiencing a sexual abuse and वो intense हो जाता है, so if the client is not even aware and not able to associate it with a positive cognition belief, so give me an example like how I will associate it and how I'll tell the client. Like basically the clients are coming to us with that reason only so that we can help them. So how I will provide a positive cognition to the client.
Okay, so in that case, I think everyone know about that alternative technique in CBT, like it's kind of one kind of Socratic technique. Okay, so think alternatively. So we can motivate the client. Okay, that think of giving option that you can think alternative positive thoughts regard for that association. Okay.
मैम शी वांट्स एन एग्जांपल एक्चुअली दैट्स व्हाट आई वाज ट्राइंग टू टेल हर कि कोई भी एक टेक्निक एक काम नहीं होता है यू नीड टू एसोसिएट इट विद मल्टीपल techniques as well like you mentioned CBT even I mentioned earlier she
Yes.
wants an actual example like how you will deal with it if suppose the client is in front of you then how you will be dealing with it how you will be telling the client the positive cognition she wants an example of it
Or for sexual abuse.
yeah if the client has experienced a sexual abuse yeah
I'm still unclear about the question. For sexual abuse, see one positive association.
like yeah when I mentioned like you need to associate a negative cognition with a positive cognition so how if the client is unaware about it how to associate it she wants an example like how you will be giving an example of a positive cognition basically actually we don't provide a positive cognition
Yes,
the client
definitely.
itself comes up with a positive cognition but she wants an example like how we will be providing it.
Okay, how will help the client?
I think it's about helping client. Then obviously CBT technique works, but she
Yes,
wants
yes,
direct
definitely.
positive cognition, which we can associate. We can tell the
No,
client basically.
we can tell because it is not necessary that for which positive association is for you, it is not necessary for the client, right?
Yes,
So it won't work. Okay, it won't work for the client, so that's why you need to, so you need to may spend much time, you need to collaborate some more technique, you can add art therapy as well. Okay, so you need to try
May
different therapy,
sorry.
but we can't directly say that okay you can add this.
yeah, that's
Sorry,
what even
can
I
I
was.
just suggest you something? Maybe
Yes,
Yes,
she's asking ki like where the client is a sexual abuse victim. So at times the client blame themselves for that event, let's say, and they
okay,
feel ki okay, I am worthless. That kind of core belief is there. So
okay,
we will be because working on the core belief. So naturally, the positive like what will be the positive? How will we convert that positive core belief? Let's say I am worthless to the I am worthy of respect, right?
yes,
Something
okay,
like that.
yeah,
Maybe she is talking about that thing और वो cognition जो है वो thought अपने आप ही आएगा because जब वो उसका pain
yeah,
release हो जाएगा तो वो जो guilt है उसके अंदर या फिर जो वो blaming है self blaming है या self doubt जो भी negative emotions है वो अपने आप उस time release हो जाएंगे उसके sexual abuse से related और फिर वो
yes,
जो फिर वो पॉजिटिव कॉग्निशन या फिर जो पॉजिटिव थॉट्स है वो अपने आप आएंगे भी उस प्रोसेस में
yes,
yes, we can like in reflect that okay, well, like what are the area that you might have been valued. Okay, so it was like one incident you
yes.
were misvalued. Okay, you can reflect on other event that when you are valued by other person. Okay.
Okay, thanks a lot. Now I'm happy. Thanks, much grateful. Thank you.
Okay.
And thank you, Shweta, for providing a
Yeah,
clear picture of what exactly
thank
she
you.
was facing.
Yeah,
Actually,
you,
well, I was
yeah,
unclear about it.
yeah, Shweta ma'am, you exactly said something that is what I wanted to hear. Actually, you actually gave me that example. Thanks a lot.
Yes, that's why we need
इट्स ओके दैट इज
participants.
व्हाई वी आर अ ग्रुप एंड वी शुड थैंक लिम्पी फॉर दैट
Yes.
No, no. Okay. Okay, then everyone, I'll upload this and please subscribe to our channel. Okay. Okay, everyone can leave.
Good
Kindly
night and
share the
thank
link in
you.
the
गुड नाइट
WhatsApp group
एवरीबॉडी
as well so that I
Ma'am,
can
I didn't
subscribe
answer
with it.
about the age on which we can apply this
Okay,
therapy.
YouTube link. I think someone is asking question again.
Yes, on like what is the age range to apply this therapy?
It is applied to actually like all age
Definitely
groups.
adult. Adult.
Yeah.
Okay, thank you. Yeah, yeah. Please explain further if
Yes.
there is
So
anything else.
yes, even I had a question about it when I was researching about this EMDR therapy. Like it can be applied to veterans, military soldiers, and all, but mainly it is focused on adult people because the past which were because the traumatic event is related to the past, so might be in the childhood or in their adulthood or in their maybe teenage years basically. So Usually it is effective for adulthood.
Age range would be 25
Um,
above or 18 above?
sorry.
Age range would be 25 above or 18 above?
Not prepared.
Age range 18 above. Before, did you say something else? Because I guess
ಅದು
someone is
வெளியே சாப்பிட்டேன்
unmuted. I couldn't hear.
25. I said either
மத்தியானமா
it's
வெளியே
25
சாப்பிட்டேன்
or 18.
25 or 18. I can say 18 works. No
Okay.
doubt. Yes.
Okay. Thank you.
Yes. Welcome.
காலைல மட்டும் தான் நான் வெளியே சாப்பிட்டேன் அப்புறமா வேற எங்க சாப்பிட்டேன் நானு
Sumita ma'am, do you have any doubt? You are.
அவன் கடை மூடிட்டோம்னா அப்புறமா you range போவாது.
Ma'am, I missed the answer. What did you say? 18 or 25? I was typing.
Yeah.
18, or you were answering 18 or 25. I missed that. I was typing, ma'am, ki you please share the link on WhatsApp because I am attending on laptop.
Yes, yes, I have text in the
No,
chat
I'm
box.
I missed the answer ma'am gave. It is 18, 25. What the age limit?
Yeah. If the experience is of childhood, so the 18-year child can also work with like go about EMDR therapy.
Okay, thank you. Thanks.
Yes. Welcome. I hope all the doubts are cleared.
Yes, everyone can leave. Krishna, you can remove two participants are still there. You can remove them.
Yes, I'm doing the same. Yes, ma'am.
One more is okay.
Yes, done.
Okay. So big clap for you. You have done very good job.
Thank you, ma'am. Ma'am, seriously, it was.
Yes, obviously. Like you have a lot of patience. Like it's been 2 hours. I'm like sitting, I'm thinking that when it will finish. But yes.
I know actually because yeah, I did mention before कि 1.5 hour तो लगेगा ही because वो 8 phases में ही ज़्यादा time चला जाता है.
So like people, but still people who are active till 9 p.m. Right? People are waiting and people are already like sustained their attention. So like yes, it was really like in depth.
I am glad about it, ma'am. Well, how many participants joined?
Around 39.
Oh, that's nice.
Yes, we have like I have added that in group also.
Okay. I'm glad. Ma'am, do you have any feedback for me, like how to do it or something else?
It
Maybe
is
not a
like
yeah.
as they like if you go like if you train anyone, okay, in that perspective it is like excellent, okay, but if we are giving it free, okay, so we don't have to go so in depth, okay, so like we can explain things once, okay, if you have like they have any doubt, so then we can make it clear, but okay, but so we don't need to go so much in detail because we are giving it free, right?
No doubt. Ma'am, actually, it was just a glimpse. It is actually much in depth, and you might be knowing it, no doubt. This was just our 8 phases, but they were having doubts in that only, so that's why
Yes,
it
actually,
consumed a lot of time.
yeah, no one like EMDR is hardly people use. I also don't use actually. And main problem is that if you use like EMDR, you need to have like expertise. It's not like that
Exactly.
you learn
You
online because
cannot
it's
give it
very
with the
intense. You
normal
are like focused.
counseling. Yes.
Like it's like one technique was there in exposure prevention flooding technique, right? So it's like kind of flooding. You are directly giving like exposing them to that traumatic situation. So for without expertise, people won't be able to handle that. I guess.
Right, ma'am. Obviously, a trained professional is required, no
Yes.
doubt. Ma'am, like, do we need to give a feedback form?
Okay, so I'll just stop the recording. Otherwise, I have to again edit it.
Uh,
But you stop the recording.